Hey everyone, and welcome to an awesome episode of Dental Nachos CE on TV. If you're watching live, you can earn live CE credit and ask questions in the chat. We'll ask our awesome presenter today, Dr. Hannah Hobbs, about them. But before we start our CE on TV show, I have the awesome Mitch from Straumann here, who's supporting this episode of CE on TV, sponsoring the awesome Dr. Hannah, and the first implant I ever placed in my dentisting career, which this was now 18-ish years ago, 17 years ago, was a Straumann tissue level implant. So it brings me back to one of the best experiences of my entire life, learning to place implants, which I call nachos, Mitch. Implants are nachos, teeth are tacos. I'll let you know, nachos, a lot more relaxing. However, we're gonna learn about all the complications today, what dentists love when things don't go right. Dentist's favorite subject. So Dr. Hannah is gonna share implant complications with us. Before that we get started, tell us a little bit about yourself, what you do at Straumann, and some exciting things they have coming up.
Awesome. Well, thank you so much, Paul. I appreciate you guys organizing this today and really excited to have Dr. Hobbs share some of her great tidbits about Straumann and Peri-Implantitis here today. So yeah, my name's Mitch Capriglione. I'm the local territory manager for Straumann in the Triangle area of North Carolina. So Raleigh, Durham, Chapel Hill, depending on how familiar you are with our state down here. And essentially, I help manage our relationships with all of our specialists as well as our general dentists throughout my territory. So whether that's on-site support, just helping out chairside or providing any materials, helping with ordering, things of that nature, we're basically here to just help make things as easy as possible to use the Straumann system and provide the best results for your patients.
That's awesome because, doing implants for 17 years, replacing multiple systems, restoring multiple systems, there's a lot of parts and pieces, and you need the reps to know those parts and pieces to help you out. On Dental Nachos and other forums, people will throw up, a solid abutment from 2004 and say, what's this snap cap thing, go with this? And you get to ask your Mitch about that. Now, how could people, we're gonna talk for a few minutes, but if someone's watching, they want to reach out to you directly, what would be the best way for them to do that?
Yeah, so whether it's by email or phone, however you prefer, my email is just my first name and last name with a period in the middle. So mitch.capriglione@straumann.com. And I know that's a mouthful, so I'll make sure to throw that in the chat here later as well. And then I always have my cell phone on me as well, so I'll make sure to throw that in there also.
Put that in there. We really appreciate it. And what are some things coming up at Straumann that you can share? What are some exciting things about some of the technology that you guys are developing?
Yeah, so I think, Straumann is no longer just a dental implant company. So whether it's our biologics line or our digital offerings now, we are dedicated to making sure that we're bringing well-researched and needed products to the dental industry today. So I would say probably our most exciting new offering is our new BLX implant line. So especially with today's, immediacy and, just our patients' expectations that they don't want to wait 9 months to get a tooth anymore, we designed the BLX for those immediate cases where you can immediately load and just give the patients the best possible results. So while every case absolutely isn't an immediate one, if that's something you're not offering to your patients yet, I would highly recommend reaching out to myself or your local territory manager so that we can have a conversation.
I like that. You can answer the question, are we there yet sooner, like the kids in the car, to the tooth restoration? I have to say, and I don't know, how laws work, but, I know Anchorman, Stay Classy, San Francisco, or whatever, San Diego, Straumann has always been a very classy company. From all the reps I've dealt with, that ones that don't even work there anymore, to going to CE courses. As a very young dentist myself, I've always really appreciated just how professional and classy and how forward-thinking the company has been. And I really appreciate you sharing here. We're going to get Dr. Hannah started, but thanks so much for being a Nacho supporter and sponsor, Mitch, and we look forward to doing more with you in the future.
Yeah, absolutely. It's my pleasure. Thank you so much.
Awesome. Thanks, Mitch. All right, Dr. Hannah, you can share your screen when you're ready, and we're going to get started. I'm going to read a couple things here about Dr. Hannah. Hey, Dr. Hannah, look, I'm so happy you're on video. This is great. Well, first, I will read about Dr. Hannah's bio, and this course will review complications encountered with implant restorations, how to avoid potential food traps with implant crowns, how to avoid restoration failures, and understanding the design of the appropriate abutments and crowns, indications for immediates, peri-implantitis versus peri-implant mucositis. Dr. Hobbs is a diplomat of the American Board of Periodontology and has been for over 25 years, has over 25 years of dental and periodontal experience, earned her undergraduate degree from University of Maryland in College Park, and went on to receive her DDS from University of Maryland, graduating magna cum laude, general practice residency in York, huge general practice residency fan myself, following chief resident year at Carolinas Medical Center, worked as a general dentist in Charlotte for several years for studying, specialized in perio. Very good decision there, Dr. Hannah. Attended UCSF for that. So she's married to Jim Greensboro, a native of a Greensboro native to Jim, and proud parents of daughter Madison and a rescue cat and dog. I love the people part. So Dr. Hannah, I want to thank you for being here. And also, that's your dental self, but your person self, which is the most important thing at Nachos. Bring your person self first, and your weird dentist self second. You've been a great supporter, a great contributor. I always love when you email me back from my Dr. Nacho emails, sharing, and I just am so thrilled to have you here. The way this works, a phrase that I use a lot with patient explanation, is that we're watching live CE on TV. If you're watching this on demand for any reason, there's going to be a quiz at the end. If you're watching live, there's going to be a code at the end that you enter to earn live CE. Dr. Hannah is going to talk for 50 minutes. If you have questions, ask them in the chat. Dr. Hannah, if you see my face come on, that means I want to ask something. If you don't see my face for 50 minutes, that just means I'm sitting back here enjoying things as well. And then we'll have a brief Q&A at the end. So I'm ready to turn it over to you, Dr. Hannah. Thanks so much for being here. A great crowd here in the chat. You can share where you're watching in from. Dr. Hannah, I don't know if you are muted or not. I know I was hearing you before. Really like how you save this as the peri-implant complication nacho lecture.
Now can you hear me?
Yep, I can hear you now. You're doing great.
All right, let me find my presentation.
I mean, I see it, Hannah Hobbs, DDS, MS.
All right, there you go. All right.
And thank you for saving us peri-implant complication nacho lecture. I feel honored to have that as how you saved it. So I'm going to turn it over to you for the next 50 minutes. If you need me for any reason, I'll be back here watching, and then we'll do a Q&A at the end, and people can engage in the chat the entire time. You see my face come on, Dr. Hannah, that means just stop. I might ask a question in between.
Okay, that sounds good.
Awesome.
So I got a lot of slides I was going to try to go through. Some of them is background information. I may not get through everything, and Paul said maybe I could do another presentation, but I'll try to get through it. So when you do an implant or when you restore an implant, it can go either really, really good or really, really bad. And so I'm here to help you figure out when it goes really, really bad, what to do and how to diagnose the complications. Obviously, this is some background info. The number of implants being placed is probably over 2 million annually. And the survival rate for an implant should be about 94, 95%. But increasingly, as a specialist, I'm seeing more and more implant complications that are being referred to me. So the incidence of peri-implantitis is definitely growing. It can range from as little as 0 to 14 years. It can range from 6.6% to as high as 36%. This is in our periodontal literature. So as you can see, a third of all implants or more will have some kind of complication, whether it's fracture, peri-implantitis, peri-mucositis. So topics I'm going to cover today is implant placement and timing, immediate versus delayed, temporization, immediate loading, pros and cons, guided surgery, abutments, whether to choose a custom or stock abutment, and then lots and lots of case presentations of complications and how I've dealt with them. So in the anterior for an ideal implant placement, this is you as a restorative doctor or surgeon should be looking at. The implant needs to come out of the cingulum area. In a highly aesthetic area, the implant needs to be no more than 2 to 3 millimeters apical to the adjacent CEJ. And I'll show you a case later on of when it's deeper, what happens. Any deeper, you have an infrabony defect from the implant to the adjacent teeth. So you really want to consider how deep you place your implants. Ideal tooth to implant distance in the anterior is 1.5 and the posterior is 3 millimeters. And you want to preserve the buccal plate, so you want your implant to be 2 to 3 millimeters from the buccal plate in the anterior where the plate is thin, and 1 millimeter in the posterior. So here is an ideal emergence of an implant. You have it emerging as if it's in the cingulum. This is an unideal presentation. The implant is too close to the adjacent tooth. It's pretty close to unrestorable, and that's what happened in this case. We wind up leaving the implant to sleep, and the patient had a Maryland bridge done. This is a very important slide if people want to take these numbers down. So the inner arch distance that you need for ideal implant placement, if you're doing a screw retain, you need as little as 7 millimeters. And if you're doing a cemented crown, you need 9 millimeters in the anterior, 7 millimeters in the posterior. This is something that needs to be thought about before the implant is placed, not after. For a complete denture, you need about 12 millimeters of inner arch distance. For a fixed hybrid, 14 to 17. If you are using conus, it's a little bit more. So these are some of the indications for immediate implants. If you have divergent roots, there's no large infection, there's connective tissue attachment or good soft tissue profile, the adjacent teeth are sound, and it helps minimize the number of surgical procedure. Contraindications would be root proximity if the roots are tipped, malpositioned tooth, the one that you're taking out, because unless you can change the path of the tooth, the implant's going to be malpositioned as well. Large, soft, and hard tissue defect, and of course, lack of attached gingiva. When you have a failure of the implant, this is what I was taught in residency, early failure, which means within like 3 to 6 months, and it happens pretty quick. You're getting micro movement of the implant. There's surgical trauma. It could be from overheating the bone. It could be from impaired wound healing, but more than likely it's surgical trauma. You've overheated the bone when you were drilling. And pressure necrosis. If the implant is torqued at a very high capacity, you're crushing the bone as you're seating it. Late failures are usually due to residual cement, number one culprit, biomechanical issues like overloading, off-axial loading, prosthetic designs that could be a problem, and trauma from occlusion. So usually when I place an implant, I ask that the patient please invest in a hard mouth guard, because you're spending all this money. You might as well try to protect it with a hard mouth guard. So these again are just reviewing the prosthetic failures for implants. Could be prosthetic instability, occlusal trauma, fractured components, cement, and probably even fractured implants. I forgot to put that. So just to review some literature, you have, again, the different 5 fibers that you see around a tooth. I won't waste a lot of time on this because most of us are probably aware of this. Whereas you compare it to a tooth to an implant, here you have a tooth, you see the different fiber orientation, whereas around an implant, you only have one fiber orientation. So there's less vascularity to the sulcus, and the response to the pathological insult is not as easily stopped by the ligaments as it would be around an implant. So the lack of Sharpie's fiber makes the implant more susceptible to bacterial infiltration as compared to teeth. And then getting the proper restorative emergence from the abutment is very vital to the health of the implant and the surrounding tissue. And if I may stop here and say that about 5 years ago, I went to Straumann and was in a special tour with my Spear Study Club, and we got to hear Dr. Robert Vogel speak, and he was an incredible speaker. He taught me so much about abutment selection that I went back to all my general dentists and discussed that with them. And it was really eye-opening that how different an abutment selection can make to the life-term prognosis of the implant. And I'll go over that in a minute. So these are some definitions. Peri-implant mucositis is the presence of plaque-related inflammatory soft tissue without any concurrent bone loss. So you just have inflammation. Whereas peri-implantitis, you have inflammation in combination of bone loss. And this was first characterized by Albertson and Isidore in '94, and then these two guys in 2008. So the prevalence of peri-implantitis is actually rising very rapidly. You know, I'd seen in our literature somewhere 33 to 36%, but in the general dental literature, it's about 43%. I'm sorry, that was peri-implant mucositis. So you can see it's on the increase, and I'm sure all of us have dealt with complications from implants. So the biggest thing on this slide, if I could urge anyone, just because someone is missing a tooth does not mean they need an implant. You need to stabilize their periodontal status first, step back and look at the big picture and see if they're truly an ideal implant candidate. If they're missing 12 and they have no posterior teeth on the upper right, replacing an implant in 12 is not necessarily the correct thing to do. That may be what the patient wants, but in the long term, that's not going to last them. Attached gingiva on implant. This can be kind of controversial, but in my clinical experience, I have found that if you lack attached gingiva around an implant, you're going to get progression of bacteria down to the base of the implant or the head of the implant, and you're going to get more plaque accumulation, gingival inflammation, bleeding, and mucosal recession. So you want to look at this before the implant is placed. Okay, so if you see a patient that you're probing implants on, and hopefully you're probing them every year, and what I do is I probe implants every time the patient comes in. Oh, shoot. And sorry, hang on. And hope to see no pocket more deeper than 1 to 2. If the pocket gets deeper, then you want to treat that sooner than later. Okay, so here you see you have severe attachment loss on tooth number 2. I'm sorry, implant number 2 and tooth number 3. The implant lost a lot of bone, and therefore the patient wind up losing 2 and 1 and 2. So I wind up taking out tooth number 1 and 2, and I grafted the distal of 3. I don't know why. Sorry, hang on.
Hey guys, I can fill in some time with some dental jokes while we get Hannah's presentation back up. Ariel, you still there?
Yeah, I'm gonna call her. She's not on at all anymore.
It's the share screen thing.
No, she's not on.
Cool.
Like at all.
While we're waiting for that, there's a couple things that we can do in the meantime to share value. We have a lot of people watching in, which is great. Share if you've ever seen peri-implantitis. When was the last time seen it? Dallas, Texas, DC. And how do you explain it to a patient if they have peri-implantitis? So it's not easy to explain things to patients when things go off script, not wrong, off script, not wrong, off script. Don't say wrong, say off script. So I had a case where I did partly as a resident in 2005. So you guys are in the chat. I want you to, yesterday was with a dentist. So tell me, if you were the patient and you had like 80% bone shrinkage, all of your teeth would benefit from being removed. You came to see me in 2005. You hadn't seen a dentist in 30 years. Your teeth were removed, bone was preserved, 7 implants were placed on the top, 5 implants on the lower in 2005. Then you lived the life for 9 years, 9,000 meals. You came for maintenance. You tried to keep up with the case, but I saw there was bone shrinkage around some of the implants, and we needed to intervene. And we needed to remove 2 of the lower implants and transition it to a removable case. So you did this case in 2005 after not seeing the dentist for 30 years. You're the patient. You spent $60,000 on the case. And 9 years later, the lower portion had to be transitioned, and you need to have a lower made that snapped in. Would you be angry? Would you be sad? Would you think, hey, I got 9 years out of it, not too bad. Cars last that long. Share with me how you would feel if that happened to you. Sad. But the person who's sad, who I know is in the chat, comes as, would you be sad if you had to replace a car after 9 years? Would you be sad if you drove a Honda RDX where your kid smashed goldfish in the back? Would you be sad after 9 years for a car? Pretty normal to get a new car after 9 years. Also, how do people take care of things? I have 2 daughters. We park behind our place in Philadelphia. The wear and tear on our car, an RDX, is more than what would happen to someone who parks in a driveway in the suburbs and only drives it now and then. So managing patients' expectations is key. So while dentists might be sad or mad, this patient understood why we needed to shift gears and make a lower removable. And he actually likes his lower removable, and we've maintained a good relationship. So what's key, when you do fixed implant cases, full arch that stay in all the time, they require exceptional care. So I'm going to share with you guys a patient that we did 12 years ago, very similar case, and his case looks almost just as good as the day I put it in.
Technical difficulties, it's just, you know, what happens.
So what do I do? Share my screen.
Oh, is she back?
I'm back. I'm so sorry. I don't know what the heck happened.
That happens. I was doing it, Peri-Implantitis material. People, it was killing while you were gone.
What? Okay.
Doing a lot of what's the deal with Peri-Implantitis, like Dennis Seinfeld. They loved it.
Okay, sorry. So
Sure, no problem. I infused the learning
now?
into the experience. Share your screen again, right?
What'd you say? I'm sorry.
I think you have to share your screen again.
Share.
Yeah, I'll talk to you on Zoom, Hannah.
Share. I'm trying to find it.
The green button in the center next to chat and participants at the bottom. You had done it before, no problem.
Yeah, I know. I just can't find it on here.
So when you look at the Zoom window, there's a mute. Do you see mute and stop video?
It should say unmute and stop video.
It says participants. Do you see participants? In the bottom.
Oh.
Chat.
Do you see it now?
Not
Don't.
yet. You have to hit share screen.
Oh, here it is.
Got it.
Got it?
Look at that.
Sorry, y'all. My power cord died. Had to run downstairs.
No problem. Cement on an implant abutment. They're back. There's the stuff that goes wrong. Enjoy, everyone.
Sorry, everybody. Just my luck. But anyway, so you can see here, this is a case that I opened up, and you see cement. Number one culprit. These are the different types of implant, external hex. Most of the ones that we placed now are internal hex, and you have tissue level ones like Paul said he placed before. So here you have peri-implant mucositis versus peri-implantitis. As the definition I gave you, this patient has peri-implantitis. They lost bone around the implant. You have soft tissue inflammation, and this can be, you know, it varies from system to system. I'll be honest with you, I've been placing Straumann for about 6 years. I have literally had one failure. That is one of the reasons that I almost exclusively now place Straumann. I just love the system. It's easy to work with. Here you see the lack of attached endo. I talked about that before. You have mucosa. It's very difficult for the patient to clean. These implants are splinted. There's no embrasure. So as a periodontist seeing this, I understand why this lady has trouble brushing there, because there's no attached gingiva and it's very sensitive. Prosthetic design was less than ideal. Probably wouldn't have put two side-by-side implants, just one implant with a cantilever. So I'm going to skip through some of these like background slides, but I wanted everybody to look at this. This is a very important slide. When you have a patient who's periodontally healthy, you're going to see complications with Straumann about 3%, Nobel 10, Astra 9, other implants 14%. So you see 3 times the rate of complication from system to system, Straumann being the least. When the patient has periodontitis, remember we talked about that earlier, don't place an implant in a patient with uncontrolled periodontal, you will see the failure rate skyrocket. You can see it as much as 30% in Astra, 30% in Nobel, whereas the Straumann is about 11%. So the treating patients, placing implants in patients with uncontrolled periodontal will ultimately cause your implant to fail. And unfortunately, the patients don't understand anything about that. All they care is about having a tooth. So controlling their periodontal disease is key. And to me, using a system, a Straumann that is stable, that's going to be around for a long time, that's well supported is key. All right. So immediate versus delayed provisionals and an immediate implants. I went through this already, but here's a case. This patient was tooth number 9, was endodontically treated and had an apical, and it was failing. And it's a little dark, the photo, but she was just not happy with it. So I decided to take the tooth out and do an immediate implant. And I did an immediate provisional of a flipper. I used to do a lot of immediate fixed provisionals, but I've gotten burned 3 or 4 times where the patient says, well, I have a tooth, I don't need to go on and spend the money for an abutment and crown. And then nobody wins at that way. So I've learned to put that flipper in there just for the annoyance factor, so they proceed with the final restoration. And here is, this is actually a Astra implant that I used to place. It's a wide implant. I probably would not place one this wide now in my career because it's a little too wide for a central. And then here she is with a flipper, and here's her final restoration. It's really hard to decipher that 9 is her implant. She's got a beautiful soft tissue emergence. That has to do more, not necessarily with the fixed provisional, but with the placement of the implant, how deep it is, how far it is from the adjacent teeth. And that's how you can also help get great aesthetics, not just the fixed provisional. And here she is at maximum smile. So before and after. New case, tooth number 9 had an endo and an apical. And then I placed the implant. And again, it was an Astra implant, way too wide. I wouldn't place one this wide now in my career. And that's what she looked like, her final restoration. So can you get good bone around side-by-side implants? I was taught in residency that's just like a really big no-no. And in this case, I decided not to do immediate implants, and you see why. This is one of the contraindications. This tooth is malaligned. There's huge infection. So I staged it and placed 2 implants. And then here's her final restoration. None of her teeth matched, but she was pretty happy, and she was in a flipper in the meantime. Probably nowadays I would cut this flipper back to have it more of an ovate ponic. This was one of the toughest cases I've ever done, not because the surgery was difficult, but the patient came in with 6 pages of questions at her initial exam. And one of them was she had been to 5 other people, probably a hint not to treat her, but she wanted to talk about extrusion of 8 and 9 and doing crown lengthening and then doing the crowns. So I talked to her about her options, and we wind up doing implants. Again, I probably wouldn't go with as wide as I do now. These are in here, but this was about 6 years ago. Here's her implants. You can see the inflammation that she has around her previous crowns and the inflammation or lack of around the implant abutments. And she wore a flipper, and there's the flipper. It's a beautifully made ovate ponic flipper. And then here's her aesthetic result. And I wind up later on, she gained enough trust in me to do an implant on this tooth, which had internal root resorption. And then here's her 1-year post-op. So implants and type spaces, I just wanted to give a plug for the Straumann narrow implant. This is a 23-year-old who had just finished ortho, and this is the space. So I wound up placing, here's the x-ray, it's a little elongated, but the CT scan shows that he has adequate spacing. Bone was very thin. I placed a 2.9 Straumann implant, and here it is. And here it is restored. So this is an ideal indication for like a lateral incisor, whether it's a lower or an upper. The next day I saw this was referred to me to treat this recession. This is a mini implant that was placed in the Pennsylvania area, and the patient is a beautiful 23-year-old. You can see the malposition of the implant and the crown and this white thing. So she was set for me to treat the recession. You can see it's a mini implant. It really is not designed for, it's more designed for stabilization of a denture, not for aesthetic situation like this. So I opened it up, and during the surgery, I didn't know what this white thing was. I think it was the fixture mount that came with the mini implant that was left on there. So I removed it, and after I removed it, you can see how many threads are there. So the point of this is, if you don't have this space, don't go for a mini implant. Straumann has a 2.9. So Nobel and Astra have a 3.0. The advantage of the Straumann is that it can be torqued to 35 Newtons, whereas Nobel and Asterisk can be torqued to only 15 Newtons as far as the abutment. And 15 Newtons is something that most of us have in our finger hand. So you can potentially reverse torque the implant out when you're torquing the abutment down. So here I removed that pink, that white collar thing and did a connective tissue and hard tissue graft. And this is how it healed. And I told her, I saw her just about a month ago. I said, look, if you like fall into a bucket of money, you really need to have these implants removed. But she had just had them done 6 months ago. Guided surgery is ideal. If you want the prosthetically driven procedure, you need to either use a guide or provide your surgeon with a guide. So there are 3 different types of guides. There's the suck down kind. There is a semi-precision where it's just a pilot guide, or there's the one that is a guide for all the burrs. So what you need to do is you need to have a model of the dentition or scan it, and you have an STL file, and then you have your cone beam and DICOM data. You can have it unfortunately, if you have Simplant like I do, it's a closed system, and it will make you convert the DICOM data. They'll charge you for that. Or if you can send it to Blue Sky or Anatomage, those other companies will also help make a guide. A lot of people now have 3D printers in their office, and they can print a guide. So I just wanted to show a couple of more cases, then we'll get into the really meat and potatoes. This is a lady who was referred for her failing maxillary dentition, as you can see, and she had periodontal disease. So I treated her lower arch with a laser, and this is my guide that I made. So I was going to take all her teeth out. I was going to do a staged approach, but I made a guide with a dual scan where after you take the scan after the teeth are out, you put the denture in with like radiopaque BBs on them, and you do a dual scan, and then that image is superimposed on top of that. And from there, you can make your guide. And so here she is pre-op. As you can see, her maxillary dentition is failing. She was not bothered by the crowding or anything, and I had treated it with a laser therapy. And then here is my Simplant planning. And then I placed 4.1 Straumann implants in all 4 areas. And here it is with locators. And that's what she had. And actually, on a side note, this was so tight, we wind up taking the housing out of this one because she couldn't get it in and out. It was very stable. So crown lengthening, can you do it on implants? This is a very interesting case. I'll just give you the history on her. So this young lady was congenitally missing canines, and she had surgery, and then she had a block graft where they took a piece of bone from the ramus. So when that's done, the tissue is hiked down to cover the block graft, which I understand. But what in essence happens is you wind up changing the mucogingival junction. And so when this went to be restored, you see how little of the abutment is visible. And this is what it was. So when the dentist seated the abutment and the crown on the canines was smaller than the laterals. And so the patient was super unhappy. So she sent her to me to see if I could do something to lengthen the crown. So what I did was I flapped it open and I crown lengthened without really removing maybe like some bone on one thread or 2, and apically repositioning the tissue so that more of the abutment was above the gingiva and they had a better emergence. And then the patient sent me this photo during COVID. This is her restored, and she was very happy. So that was a complication that had more to do with the implant placement depth, not looking at the interocclusal arch distance before you start, and the fact that she had a coronally repositioned flap with block grafting. Again, I just want to emphasize that implants are a restorative driven procedure, not a surgical procedure. If you're getting your implants back from your surgeon and you're not happy with where they are, you need to have a say in that beforehand by giving a guide or having a diagnostic wax up and a guide to help plan the surgery so you know where you're going to end before you start. Why does anyone think this happened? I don't know if we have time for questions, but the implant is very facial, so you have a dehiscence here. So how do you treat that? The only way to treat it that I know, and when we have an ailing or failing implant, I literally throw the kitchen sink on it. You can either remove the implant and do a ridge augmentation implant for another implant, but I told a guy that I was going to try both hard and soft tissue defect correction, which I did, and I'll show you. Without proper planning, you can get this, where the implants are totally facial. You're using pink acrylic, and the implants they're angled, misangled. So again, planning and communication, whether it's for you that you're doing the implants or you're working with a surgeon, this is an implant. An implant is a restorative driven procedure, not the other way around. So this is what I did for that gentleman. I did a connective tissue graft and a bone graft. Here it is the day of the surgery. Here it is 2 weeks later. And then here's his final result. So this is where we were pre-op, and this is where we were post-op. Just a plug for if you're taking out teeth, you need to do socket preservation, because studies show that within 2 years, 60% of the buccal plate mostly is gone when you take out a tooth. So learn to graft at the time of extraction. You will basically save your patient a lot of headache, because to try to regenerate a defect is very difficult than to prevent the loss. All right, here's a ridge augmentation when you have, this is a Sieber type 3 defect, and they're classified by the buccal lingual defect, mesiodistal. So this is a combination. It had a mesiodistal coronal apical defect, and I did a connective tissue and a hard tissue graft. This is one of the first peri-implantitis cases that I want to really dive into. So this young man was a 24-year-old. He was assaulted at work. An implant was placed after a staged approach where they extracted tooth number 8. So the first implant spins out at the time of implant restoration. So now it was grafted again, and a socket healed, and a second implant placed. He had a large, as you can see, a very large concavity, and this is the final restoration. So his general dentist called me and said, he's 25. Is there something you can do to help? This is after the extraction of bone graft. I was able to get the x-rays, and this is after the first implant was placed. And you can see this is a very narrow implant. Again, I think the torque capacity on seating the abutment was exceeded. That's why the first implant was failed, because it's 3.0. And here is after the second implant placement pre-op, you can see the deficit in the ridge. So here is the day when he was sent to me. I asked the general dentist if they could take the abutment and the crown off. And here is with the healing abutment. So what I did was I did both a hard and a soft tissue graft with bone and LPRF to try to basically bulk up the buccal plate, allow it to heal for 3 to 4 months, and then go back and do a new abutment and crown. So here it is, the day of my surgery that I did. You can see the concavity that's there. The implant is positioned lingually, which is fine, but there have been so many surgeries, you've lost both hard and soft tissue volume. So trying to reconstruct that. So here it is, the day of my surgery. I bulked up the ridge. This isn't all going to stay there. It's going to resorb. And you can see here in my periopack for where I did my connective tissue graft. And here he is 3 months after healing. Is this a perfect result? No. But it's certainly a whole lot better than what he had before, because this before was like a ridge lot crown, and it was a very, it trapped a lot of food for him. So he was pretty happy, and so is his restorative doctor. So the key from this is if you have multiple implants fail, you really need to overbulk your ridge. Look at the type of implant that you're choosing. And in this case, I didn't replace his implant, but if the implant fails, I would probably go with a Straumann the beauty of Straumann is that you, as you're drilling, you're stepping down your speed. You start off at 800, you go down to 600, 500, 400. Whereas other implants, you stay at 400, 1400 or 1200. And it, for a soft bone like that, it can really burn it up. All right. So this is another case. She's a dental assistant of one of the referring doctors. She had a very complex dental history. She had a root amp on 4 years ago. And then she had the mesial root fracture, and then she had an immediate implant placed in that area. And that was restored by her employer, and she had now developed a fistula and was referred to me. So as you can see, the implant looks good, but the only thing is the abutment and crown. You see the large embrasure here and here. Part of it too is the implant is sort of a slight bit off angle, and I'll talk about that later. So what I did for her, I opened it up, and you can see the ridge lap crown. So when you have a crown that's that open, that's just a huge plaque trap. So the abutment that was chosen was a stock abutment, and I'll talk about that in a minute. If a full anatomical abutment was chosen, and that's something that you as a restorative doctor have a choice in saying to the lab. You can't say to them, make me a stock abutment. That does not mean you're gonna get a customized abutment. You need to spell that out, and I'll go over that in 1 second. But you can get closer here. Can you see the implant's very lingual? And this is just a huge ridge lap, or like a saddle crown. So what I did on her, I took the occlusion off, degranulated, did tetracycline burnish, bone graft, and the LPRF. And this is what the LPRF and bone looks like. And here it is closed up. I don't think I ever saw her back for a follow-up. So the issue with this implant was that it's angled. So you have off axial loading. The implant was very lingual, so it was a ridge lap crown. That can be corrected by using a custom abutment that's full anatomical. And the abutment and the crown did not correct for the angulation issue, so there was a hygiene issue. All right, so again, this goes back to that 5 years ago when I went to that lecture. I learned about asking for a custom abutment, what types of abutment, and always ask for manufacturer specific parts. So let's say you're using Astra, you need to use an Atlantis abutment. If you're using Nobel, it needs to be a Procera abutment. Without that information, without the component manufacturer parts, you've basically voided the warranty on that. So if you use, let's say with Straumann, you use the Straumann abutment. If the implant fractures or fail, Straumann will replace the abutment and the crown and the implant, not necessarily the crown, but those two parts. And I mean, that's a big savings to you and to the patient. So just to review, teeth are not round, right? Teeth are ovate. So your abutment needs to be ovate. This is different types of abutments, zirconium, gold, titanium. This is a full anatomical abutment. Your abutment should look like a prep tooth. The retention and resistance form, whether it's cement or screw retain, comes from the ferrule space from the abutment. And the only way to get that is from a customized abutment. Here is a view, here's a view of what a stock abutment looks like. This is like a direct abutment on an Astra implant. And here is a full anatomic customized abutment. You see, you're getting it looks like a prep tooth. You're getting the full emergence of the soft tissue being pushed out by the abutment, not by the crown. So the space to fill the space for the implant is taken up by the abutment, not the crown. Here's a cross-sectional view. Here is a stock abutment, where you see how it's narrow and then you get that sort of apple on top of it, apple on a stick, or you have the customized abutment where it goes out and pushes out the tissue, then the crown. Literally the difference between these two is $20 for the lab, literally $20. So you will get the patients on this come back and say, you know, I love my implant, but everything I eat goes between my teeth. That's because they have a stock abutment and the embrasure is really large, and then they wind up getting recession between the, you know, and of the papillas, and the embrasure's open. This is a view of what a custom abutment crown looks like versus a stock abutment, and you see the difference. These are different views of the, this is a full anatomical abutment. It literally looks like a prepped molar. This looks like a prepped lateral, and so does this one. This is a gold hue abutment. This is zirconium. More people are doing gold hue or zirconium to titanium to, if you have a high lip line and you're worried about the thin biotype. Again, comparison of a stock abutment, more of the crown fills in the space versus the custom abutment, and this is a full anatomical. So there's a full anatomical, soft tissue sparing, soft tissue forming, and you need to communicate that with the lab. Don't leave that up to the lab to make that decision for you, because they're going to defer whatever the computer has in front of it. And some labs, as a matter of fact, will take a stock abutment and prep it, and they'll call that a custom abutment. What you should look for every time you come back is whether you have a manufacturer sticker that says, let's say it's Straumann, it says Straumann parts, reference and lot number, and you have that in, you scan that in a chart. If you don't have that, you don't have authentic manufacturer's parts. Okay, so I wanted to tell, did you want me to answer a question, Paul, or no?
You can answer a question or two. I can read a couple to you. One, we have, I have a case like that, the number 30 implant that you showed. This case was placed and restored by a previous dentist at my practice, and the patient was resistant any further treatment. Any advice you'd have for modifying the emergence profile of the new crown alone to enhance cleansability?
The only way you can do it, if it's screw retained, take the crown off, open the embrasure, and then give them a proxy brush. But without changing the abutment and the crown, you're hampered by what you have, because the abutment sets the tone for the crown. Yeah. I think that's the biggest thing I need to explain, is that the abutment sets the tone. If you don't have the correct
100% custom abutment style cases, I think it's helped a lot. So, you know.
All right. Yeah, I mean, honestly, until, like, I've been a dentist for a while, and until 5 or 6 years ago, that wasn't even on my horizon that I could ask the, you know, I, as a dentist, could tell the lab, look, I want you to make this kind of abutment. So actually, one of my restorative daughter got a stamp that said, only use authentic manufacturer's part. She stamps it on every lab bill she sends out, and she asks for a custom abutment. You can't just say custom abutment. I mean, if you're using Astra, you have to say Atlantis. For Nobel, you have to say Procera, because a custom abutment to one lab is them taking a diamond burr to a stock abutment, and that's customized.
I agree with you. Next one, does implant success decrease as you attempt the implant at the same site? I guess if maybe that's related to a failure.
That's a great question. Well, yes, you know, so we learn in school, if you cut the tissue and open and look at the bone, you're losing a 0.5 millimeter every time you flap it, just by opening the flap up. So the number of sites that are times it's open, you're losing bone volume and soft tissue volume. So the less procedures you do, the better. That's why I try to do immediates, unless the contraindications I showed before. And the more the implant site fails, the success rate goes down, especially if you haven't addressed bone volume, tissue thickness. And honestly, I haven't seen that with Straumann, but I've seen that with other systems.
Nice. And one more question, I'll let you go. And I remember years ago, we could expect bone loss to the first thread. Is that the same now? How do you differentiate between normal bone loss and peri-implantitis? This person is from Durham, North Carolina, so maybe they'll come over.
Nice. That's a great question. Yeah. So no, you shouldn't expect 1 millimeter. That's the old Zarb study that showed you had 1 millimeter of bone loss within after the first year to the first thread. No, you should not have 1 millimeter of bone loss at all. Your bone level should be at the height or the crest of where the implant is. So, and I'll show some examples of that.
Awesome. And this presentation is phenomenal. Hannah, and please, there's the test now, everyone, very philosophical. Where's our test? Life is our test, right? So whatever you get through is awesome. We can always have, like Rocky from Philadelphia, Hannah Hobbs part 2, okay? So don't feel any pressure to get through anything. Just, you're doing awesome. So I'm going to let you go and continue on your presentation.
Yeah, just tell me. I mean, I know how. I'm sorry about the power thing.
No problem. I was doing
could
good
probably.
material. Don't worry about it.
I probably have to stop. Like, I can't get through all my cases, but I wanted to show this
No problem.
because
I'm gonna let you keep going. I'll be back in about 15 minutes or so. Enjoy.
okay, this happened to me. So I learned from my mistakes. If you place your implant too far from the adjacent tooth, you're gonna get proximal caries on the adjacent tooth. So this study was a very eloquent study. I don't know who sent it, but you see if the implant is less than 2 millimeters, the rate of decay on the adjacent tooth is this. But the further away you go, the higher the decay rate, because you're going to have a cantilever, and it's an uncleansable site situation for the patient, and so your caries rate goes up. So here is a Straumann implant I did on 18. This is the appropriate distance that it should be distal to the back tooth. And with a custom abutment, you're going to get a beautiful emergence profile. Again, the abutment sets the tone for the crown. When the abutment and crown keep coming off, what is going on? I'm sure all of us have that. Well, you're like, well, you know what? I'll change the screw. It's a strip screw. Or the abutment isn't fully seated, so I'll take it off and put it back on with a new screw. Or maybe I'm going to add this. Maybe the implant is fractured. So I'll show a couple of cases. This is a 56-year-old female who had an implant in the area of 3 that had to be redone twice. And she had an implant in the area of 14. The abutment and the crown kept coming off on 3. The surgeon checked the implant, thought the screw was loose. So they replaced the screw. This was done twice in the abutment, both at the pocket of the general dentist. So the x-rays to look at, this is the first x-ray, second x-ray, the most recent x-ray. You're starting to see some bone loss on the mesial, right? She goes back to the surgeon. Yeah, everything looks good. It must be, a strip screw. So I took the abutment and the crown off, and look what you have here. You have what we call flowering. Now, 2 CT scans were taken on this patient, but you can't see that in a CT scan because the metal will distort, and you will distort the image, and you cannot see that. So you have a fracture on the implant, and here is the implant. The implant is fractured here. I was able to grind it out, but part of the implant was fractured. But that was not visible. But the reason the abutment and crown came off was because after a while it would get loose because there was a microfracture in the implant, and finally it flowered away. Factors that can lead to increase of screw loosening is parafunction, the abutment not fully seated. Excessive torque on the implant placement is, to me, a really big reason for that. Not being able to seat the prosthesis passively. This is when you maybe have an all-on-4, you want a passive seating. Poor implant position and angulation, increased crown to implant ratio, and cantilevers. So how can you reduce these risks? First of all, every implant should have a narrow occlusal table. It does not need to be as big as the tooth that you're replacing, because remember, the implant has no PDL, and so there's no proprioception. The patient will generate a lot more force on that. The occlusal forces should only be in the central fossa. You need to increase the abutment diameter, and I talked about that, like having a full anatomical abutment for a molar. Continue to evaluate and adjust the occlusion at recalls. And something else I learned, has anybody seen where, let's say the implant is a 19 and the patient comes back a year later and there's an open contact between 20 and 21. And I don't know if anybody has seen that, but here's what I have heard and here's what I've seen. So you're trying to seat the crown on 19 and you have to grind the contact down. So you grind the contact down. Oh yeah, here goes the crown seats. You seat it down. Well, you didn't polish that contact. So that porcelain is super rough. It will scratch the distal of 20. The distal of 20 will drift towards 19 and open the contact between 20 and 21. So if you're going to adjust your contacts on the implant crown, you better have a polishing ability to polish that porcelain. Rough porcelain is very tough on and can rub away enamel, which is hard to believe, but it can. And I think we've all seen that. You need to take yearly periapicals on your implants. Have a hard mouth guard. That's an absolute given. And when the implants are placed, you cannot exceed the torque capacity on the implant. So for Straumann, I usually start my implant with a motor. I start at 15, bump it up to 25, and then I'll go to my hand driver to 35. I never place it over 35 because what you're doing, you're just compressing the ability of the bone to adapt and you're crushing it. Same thing with seating the abutment. You seat the abutment at the manufacturer specification, wait a few minutes, torque it down again, and that should be it. So let's look at the lower left implants. This patient obviously had a lot of implants and was referred because this implant kept, the prosthesis failed. So here we look, here's at the time of restoration. This is a very narrow implant. This is a molar, remember. Very narrow implant. It's too far from the adjacent implant. Remember our distance, 2 to 3 millimeters, and it's off angled. So as a result, you have undersized implant, off angle placement, and it's too far from the adjacent implant. So you have a cantilever. There's so many things that are against this from working that it obviously did not succeed and it wound up failing. But as you can see, look at this large cantilever. And that's what the lab had to do to close this contact. This implant needed to be like right here, and it could not be a 3.5. This is a molar. You cannot use a 3.5 implant for a molar. All right. I don't know if we have enough time, but this is my next big case that I wanted to show. This is a lovely, lovely patient that was sent to me for a second opinion. She had pain in the implant sites the day they were done. The implants were followed by the surgeon for, I think, about 2 years. And what she had done was extraction of 7 and 9 with immediate implant placement. She was not happy with her aesthetics. She had a high lip line. She's a very, she was on TV a lot. And literally the implants are 10 millimeters below the CEJ of the adjacent teeth. Here is the CT scan that I have, that I took the day that I saw her. As you can see, here is the CEJ, and that's where the implant's on. Her pain was right here. So remember we talked about the depth of the implant? This is an infrabony defect. So the bone on the tooth is here, but the bone on the crest of the implant is here. And the body just cannot handle that discrepancy. She had sharp shooting pain like here and here. And here's her aesthetic result. She was referred to me to see about covering some of this recession that existed on her adjacent teeth and maybe making her teeth not as long. So this case really, like, I saw her at the end of 2019 and I actually just finished her about a month ago. I went to the manufacturer, which was Nobel, and I said, can I get the implant removal tool in here? And the guy who designed the implant removal tool called me and said, there's no way. There is no way you can get this down. It's only 17 millimeters deep. You're going to have to use an extender, and the extender will increase the torque capacity on the implant removal kit, which means that will break off. So what I wind up doing, I said, okay, I'm just going to bury these implants. So the day of the surgery, I opened it up. And I saw that I had some threads showing, and the implants were very facially malpositioned. So I thought, well, I'm just going to try the implant removal kit, which is like a tool you put in here, and then you put a driver on top of it and reverse them out. So I was able to reverse this one out. And then I was able to reverse this one out with different diameter of implant removal kit. And here are the two implants. One's a Y platform, which was this one over here, and one was like a regular platform. And so what I did on her is I did bone grafting, connective tissue graft, and I coronally repositioned all the tissue that she had. And I did a vestibular incision with a frenectomy. And then here is her provisional, which is a partial actually. And so aesthetically, it's a whole lot better than what she had here, sorry. And now we're just waiting. I had initially told her I didn't think I'd be able to get the implants out and she should plan on a bridge. But we're gonna wait and see where we wind up doing. What I might wind up is placing an implant here and an implant here with a cantilever on the distal of 7. So cantilever 7 off of 8 and 9. Next case, here is recession around an implant. Remember what I talked about, an implant needs to be no more than 2 to 3 millimeters from the buccal plate. Here is a keystone. This is an 8.5 millimeter implant. It's way too wide for this side. So you have proximity to the adjacent tooth. The buccal plate is obviously gone. And I talked to the patient, really lovely, beautiful girl who was about to get married, about just taking the implant out. And she's like, no, I'd like to try to just save it through I get to my wedding. So what I did, and as you can see, here's a flapped open, you see all these threads exposed. What I did was decontaminate it, place a bone graft and membrane, and then close it up. And interestingly, this was done about a year ago. She came back about a month ago and I wind up taking this implant out. What I wind up doing is taking, she was getting married and they were traveling across the country. Her and her husband are both models, so she didn't want to be without a tooth. I took a fine, really skinny diamond bird and took out mostly the facial because it was only gone, and just kept rotating and rotating and rotating. And then I got the implant out. But here it healed, and that's lasted her for about a year. And then she was ready to get it replaced and have something more functional. This is a case I just did about a month ago. This guy had these implants placed 2 years ago, and he had drainage. As you can see, he's got drainage and purulence, and the area is sore. Let's look at these x-rays. Can you see these implants are off axially? Very narrow implants. The spacing between them is an issue, but there's off axial loading. So what I wind up doing is opening it up. The crowns are overhanging to correct for that angulation problem because a custom abutment was not used. And you see some threads exposed. And this here is like this buccal ledge. So what I wind up doing is decontaminating the implants. You've got to remove this buccal ledge in order the tissue to lay closer. And so that's what I did. And I asked his restorative daughter if they could go back and take these crowns off and replace them. And I advised the patient of that. It's just hard for someone who has had these for literally less than 2 years to go in and spend that kind of money again. So Paul, do you want me to stop here or keep going?
Perfect. You are a pro. Thank you. You did awesome. Our team will share the CE code in the chat. We are going to be going right into our awesome business and leadership toppings. Stay for that. You're going to win prizes. You're going to hear from dental focus accountants, coaches, people that can help you, people who can help you collect money for almost doing nothing in your office. Dr. Hannah, you are awesome. Let's have a part 2 for sure. We really appreciate it. I learned a lot. I've been following implants, doing implants for a long time. I love sharing the challenges that I know, Ariel, you can give me the host back here. I'll just see if I can do the live for the next part.
Me? Okay.
I love seeing the challenges though, because, it's something we need to be aware of, but still stay positive. Because I did hear you say something, Hannah, throughout this. You had how many failures since you started placing Straumann implants?
1.
Oh, 1. So why do you think dentists, this is actually just a genuine question of mine. Why do you think dentists get so worked up about, oh, this tooth's going to be removed for an implant? We don't want to lose our natural tooth, our best friend, when we barely have any failures. What makes you, what do you think? Dental school brainwashing, emotions? I feel like dentists take it worse than patients sometimes when a tooth needs to be removed.
I'm a periodontist. It's in my DNA to try to save teeth. I'll do anything possible, but sometimes you just can't save a tooth. And what you need to do is give people informed consent. I can save this tooth for 5 years, 2 years, whatever, and then we can go on to an implant.
I just don't understand why there's not more happiness. Like if your tooth goes bad and you have nachos that work out like 90% of the time plus, I feel like we should be so happy about this. I feel like we should feel lucky that it's an invention that we can offer to our patients.
I'd like to put my email out to people that if you're okay with that. Sure. I don't know how to do it. Maybe one of your team can do it.
Yeah, but if you just say it, we can put it out. I also put in the chat a course on implants from us that you can get. Use the code 50FREE at that link in the chat to get the life-changing implants, life-changing impact of dental implants. Dr. Hannah, thank you. What is your email? I can type it in.
It's HOBBS, my last name, HJ@AOL.com.
Awesome. People are telling you thanks in the chat. Ariel, you can stop the live stream on YouTube and you can give me the host for trying to go onto Facebook again for this. So everyone here hanging with us, we're going to hand out the CE code. We're going to shift to a business leadership topping show where you get to learn about your mind, words, hands, how to be successful from some amazing key resources and sponsors. Dr. Hannah, have a margarita this afternoon. If you want to hang around, just hang around with us. You don't need to be a panelist anymore. So Ariel can take that and we'll have you back on for volume 2. Huge guac thanks for being part of this.
Thank you so much.
I'm a Hobbs fan, Alan Stern. See, so nice, Alan.
Alan, you're such a great guy.
Ariel, can you hear me?
Yes, Paul, I'm working on it. Sorry, I was muted.
Oh, no problem. You could do it too. I was just going to try.
Yeah. What do you want to title it?
I'll put it here in the chat for you. Okay, as we shift, I'd like to ask you, we have some amazing guests coming up. If you could put in the chat, Brandon Hill, our strategic growth director, will share a free code, $50 free code. You put in the chat, what is one concern you have as a dentist that has nothing to do with clinical dentistry? Insurance, people crying, your team crying, buying a practice, selling a practice, figuring out EBITDA. What is EBITDA? Put something in the chat that's a concern of yours. Brandon, encourage that. We can hand out a free code for that. Let me put this in the chat for you, Ariel.
I did Dental Nachos Presents Business and Leadership Toppings, Volume 5.
Perfect. Let's share in the chat. One concern about being a dentist. And my friend Alan Stern is here. Alan, what is something you wish you learned as a baby age dentist? If you go back in time like Michael J. Fox and tell yourself this, share in the chat what you would tell yourself to make your career more successful and less stressful.
Paul, I am going to go live. So if you could stop talking.
Sure.
Perfect. Nachos.
All right, awesome. Welcome to Business and Leadership Toppings, Volume 5. My name is Paul, Dr. Nacho. This is a show designed to help you do less of this. So pretend this is you DDS, crying on the inside or outside because your team's arguing, because you're having profit challenges, because you feel burnt out, because the ring thing flew off your class 2 prep, and now you're considering moving to the center of the woods and quitting being a dentist. So on Business and Leadership Toppings, we're here to help you strengthen your dentisting core, your mind, your words, your hands, especially to your heart, how you treat each other with kindness, how we treat the people in our dentisting universe. One of my comments, my mantras is no one likes the dentist. We might as well like each other. How can we bond together, to use a dental term, to share more, care more, and build a better dentisting world? One of the things that we're so proud of that we do here at Dental Nachos is Dentist Job Connect. If you're watching and you need a job or you want to hire an associate, a big step in the circle of dentisting life, just text job to 215-543-6454. You'll get a complimentary consultation from a Nacho team member about how you can find a job, how you can list a job. And also, if you're sitting here watching the show and you want to scroll through and see where jobs are, you'll immediately be texted back 40 open positions. So just text job to 215-543-6454 and you'll get that. So we have an amazing show for you today. So many amazing key resources, sponsors, friends, helping us. My team can bring up our first guest whenever they are ready. What I would love for you to share in the chat, someone said, creating a vision of a practice that I love, establishing myself as a dentist and community figure in a new state. Such an awesome one. Branding, how you can brand yourself, how you can create awareness. Will you be shut down again? Right. I'm concerned about do-it-yourself dentistry. Yeah, good one. Who knew you could just do dentistry at your house? You didn't think that was possible. Now, 2020, people just DIY orthodontics and things at their house. So really great things. One concern about being a dentist that has nothing to do with teeth. Could we post Dr. Hobbs' email address? You can put that into the chat there. So Ariel and Brandon, whenever you are ready for me to interview someone, I'm happy to do that. I'll also share a little more about you.
Jim and Tyler are all in as panels, Paul.
Oh, cool. So they can start their video whenever they are ready. Awesome. Hey, Tyler. Hey, Jim, how's it going?
Hey,
so,
good.
On this, you've been on the show many times, and you guys just three guys sitting around on a Zoom call. So I say, if you walked up to these three guys, what do? I'm a dentist. I'm a Dr. Nacho. I'm a broker. These are the things I do in the circle of dentisting life. Tyler and Jim, just share with our audience to orient them. What do you guys do to help dentists cry less on the inside or outside and be more successful in their dentisting life? Tyler, I'll let you share what you do with your company.
Yeah, to make it simple, we insure your hands, your back, if something happens where you clinically can't work, that's what we do. So when people ask that are outside of dentistry, whether it's family or friends, hey, what do you guys do? It makes what we do seem just a little bit cool. We insure people's hands.
I like that.
It's not cool, but
sometimes some things are important that don't seem cool because you can't get to do the cool things unless you protect yourself. Right now, dental students are investing hundreds of thousands of dollars. People who are practice owners invest hundreds, thousands, millions of dollars. All of us are concerned, hey, what if something happens to us, short-term disability, medium-term, long-term? To reach out to what you guys do for us, you can text DDS to 55444 to learn more about what you guys do. Jim, share with us, what's been the deal with disability insurance during the pandemic? Has it been challenging for people to reach out to you guys? Are you able to do things remotely? Tell our audience a little bit about that.
Sure. You just sound like Jerry Seinfeld, by the way. What's the deal?
Not surprised. I love Seinfeld. So,
So it's been interesting. We've had some people that have been out of work, almost a forced simulation of what it's like not to get a paycheck. But others that have just realized how important it is to have disability insurance. And so we've been busy as ever. We definitely feel for those who haven't been working, but a lot of people have been working. There's been a pent up demand for, as you know, for dentistry. And it's interesting too, because getting disability insurance now, there's one less requirement during the pandemic, and that's that dreaded nurse's visit. So if you wanted to apply for disability insurance and you're wondering when's the time, well, the time is now because you can do it without seeing the nurse.
I like that. So take any pandemic win you can get. That's my philosophy in life. Any pandemic win. So we talk about the circle of life, and I have this back here to remind myself that dreams don't come true, because I wanted to play in the NBA, and here I am. This is a pretty good life too. But if you held up this ball like the circle of dentisting life from the Lion King, where are some times where people connect with you on this circle of dentisting life, Tyler, from dental school and beyond? Where should they be connecting with someone to learn more about disability so they make sure they protect themselves?
Sometimes we connect with things that have nothing to do with disability. I think as a result of being in this business and having thousands of dentists, I think arguably people like us can be one of the most connected people in dentistry, maybe more than CPAs or attorneys, and relationships matter in dentistry big time. And you don't know when you're going to need them, but when you do need them, having those relationships, they can get certain things done. So
Such a good
sometimes
point
people
for
connect with us.
ABC to always be connecting. Maybe one day, like the butcher introduced me to my wife because my wife came in and the butcher's like, you should date him. That's not a real story. That's just an example. But Jim, you've been to Philadelphia for the Boost Camp. What are some of that's a great point from Tyler. What are some of those connectivity things? Who do you meet that you might be able to say, hey, I know someone buying a practice, selling, looking for a job? How does that work in the DDS, Doctor's Disability Specialist?
First of all, I miss the live events. We definitely enjoy when we come down and spend time with our friends, and we've got a lot of Nacho friends now. So certainly, we'll be talking with the client and they'll bring something up during a meeting and we'll connect them with like a Lisa Mergens or a Vivek Kinra or what have you. And it's just, the list goes on, and you don't even know what's going to be the next need. So just these different interpersonal relationships that we have has really proved invaluable. And Paul, it's really because of this forum that you set up here online.
I mean,
Dr. Goodman, to add to that, sometimes it's not even just the connections, but because we have these conversations literally 10, 12 times a day for 13 years in a row, we can have conversations with clients that they really can't have with many other people in their life, including their spouses, just venting about dentistry, telling them that it will be okay.
I think it's a really good, and if you're a dentist watching this, that people do that to us. Like, I'm doing your filling. I'm like, oh, your sister does sound kind of obnoxious, because they want to vent to us about some other piece of their life because it feels safe, because we're never going to meet the sister. We're never going to do that. And I think that's an important part of life. And also what you shared about connecting, sometimes it's just important to meet good people for the sake of meeting good people, be friends first. And then magically something happens later with buying a practice or selling a practice or finding a job or solving a problem, right? Someone has to go out on maternity leave and you say, I know somebody, a young dentist who just graduated from UNE who could fill that role. I want to share how to reach out to you guys, because my goal with this is keep up the momentum. Just find out whether you're a student, whether you're a baby age dentist, whether you're a medium age dentist, you just need your policy looked at. Maybe it hasn't kept pace with how much money that you're making. Text DDS to 55444 to learn more. Jim and Tyler, would love having you on, but I want you to share before we jump off, people might think, I won't ever be disabled, I'll take the risk, but where does this come into buying a practice? And you guys had a specific situation where someone had a challenge with buying a practice because they didn't have the right disability insurance. Share with us about that, because that's my goal, is to kindly annoy dentists into good decisions. What happened in that scenario?
So one thing I'm starting to realize is, I think sort of like in dentistry where patients don't love coming to your office, there's a certain anxiety, they don't like doing it. I'm starting to realize the same can be true with us. People don't want to talk about insurance.
Yeah.
And I think there's that anxious feeling. We try to make it a little bit better. We try to make it fun. But to your question about buying a practice, banks have to lend money to somebody. They borrow it from me and you in our checking account at 0%, and they have to lend it to somebody. And compared to restaurants and yogurt shops that go out of business all the time, dentistry is really good risk. The banks will beg for their business, and the only way a dentist really goes out of business is if you're disabled. You may not make what you think, even with the pandemic.
That's a good point, Tyler. Jim, like, people might not be able to get the loan though without the proper disability insurance. Does that happen, Jim?
That's the risk. A dentist goes out of business pretty much if they're disabled. Of course, there's other examples where they do actually go out of business, but through the big picture, it just doesn't happen. So the banks make you get disability, and it's a good idea anyways. You're personally guaranteeing a loan. It would be nuts, not just nuts, words, to have a $10,000 a month loan payment predicated on the expectation that you can produce a boatload of dentistry, and then if you can't, that's the purpose of the disability.
Paul, we're now using your lingo. Isn't that pretty funny?
I like that. Yeah, you're already talking Nacho.
So we did. We had a situation recently where somebody wanted to buy a practice. The banker was on us for the disability insurance. We went to apply. It didn't go well. We did solve it eventually, but it's funny because, when you first graduate, you're like, never gonna get hurt. I'm invincible. I'm young. And sometimes it's a good idea to get it just for kind of the thinking ahead almost.
And just because you want to buy disability doesn't mean there's somebody willing to sell it to you.
Right.
And it's hard to get.
They don't teach us in dental school, and you teach us more, because in life, timing is everything. Timing is another word for luck. And if your disability policies prevent you from getting a loan, as a broker, that could make you lose out on a practice due to timing. Maybe someone else is ready to go. So let Jim and Tyler be your timing enhancement specialist. Increase your luck. Before we jump off, just share, Jim, how can people reach out to you guys directly? We have our text code, text DDS to 5.
Sure. Yep. Our emails.
Reach out to you guys directly.
James.Cashmar, Kachmar at ddsteam.net, and Tyler.DeStefano, DESTEFANO, at ddsteam.net.
All right, perfect. Well, hang around. You can share that in the chat. Thanks for leading us off on this business and leadership topping show. Really proud to have you guys as key resources, sponsors, but more importantly, friends.
Thank you. You
Thanks
as
for
well.
having
We're
us.
proud to be here. And thank you for your friendship.
So this is the vibe of this, where we go through who can help you in your dentisting neighborhood. Some of these things are going to be fun to improve your practice. Some of these things are going to be things to protect yourself. Some of these things to get yourself ready for the next step. Disability insurance, so important. So we're ready for our next guest here to come. You can share your screen. And while we do that, we're going to have tons of free prizes. So one of my favorite things is to share with people how they can order off of a menu of dental treatment. So if you text menu to 215-543-6454, you'll get a 60-minute course about how to present treatment plans to a patient, and also a bonus financial agreement that we use in our office, the yellow financial form, that I've used to help get patients to move forward with momentum and say yes to millions of dollars of treatment. Sometimes you just need tools to help you. So our next guest here on Business and Leadership Toppings, share with us, with our group, Braden, what you do and how you guys help dentists.
What's up, everybody? Hey, my name is Braden Anderson. I work for a company called Dental Intelligence. And if you haven't heard of Dental Intel, basically we're an analytics and software platform to provide tools to help every dental practice across the country increase their production, increase their profitability, and increase their team performance. And so if I could go simplify, what does Dental Intel do? Here's what I would say. You've got a whole bunch of data sitting inside of your practice management software. And what we do is we go and we sync with your practice management software. We suck all the data that is sitting inside of there and we spit it back out in a dashboard format where it's digestible and where practice owners, where dentists can go take action based on the data that they have on their patient base.
I think that's great, man. What you should do is, you're like, everybody's wearing those fancy, like, tell you how much you sleep times and what you do. You guys do that for practices, and someone who's been a practice owner for 15 years, you know, a little bit better makes a lot better dentisting life. So it can be overwhelming when someone throws a lot of data at you, but use it to your advantage in ways that make sense. Recently, we've been combining LocalMed, an awesome sponsor, with Dental Intel. We send out a weekly message to hundreds of people overdue, and magically they start booking. One of the great things is you can control the booking if you want it to be in December, if you want it to be in January. So instead of your team making phone calls, I've just been incredibly impressed by how this works. So if you could tell us about that part a little bit, Braden, because every dentist, whether you are a dentist from the 1960s or the 2060s, you're going to say this: is my hygiene booked? Who's in for hygiene? We don't have hygiene. So tell us how you guys fuse together with LocalMed and Dental Intel to really supercharge that hygiene schedule.
I love it, Dr. Goodman. Hey, that's one of my favorite parts about Dental Intel. As most people know, and if you don't know, Dental Intel acquired LocalMed about 2 years ago now. And recently, as Dr. Goodman said, we merged the two softwares together. And so Dental Intel, we have all the data on your patient base. And so we can really, really quickly identify each of the patients that are due for hygiene, historically, based on data, which ones hold their appointments, which ones pay their bills, which ones accept treatment. And then combined with LocalMed online scheduling, you can go and send out a bulk text and email to hundreds of patients and allow those patients to identify an open time on your hygiene schedule, click on the link and schedule their own appointment directly into your practice management software. And I know, Dr. Paul, you're a huge fan of this because it saves so much time.
And also just, I like testing things. I have a lot of new ideas. And, you know, we did this, my awesome friend, patient care coordinator, Kate, we were sitting there getting ready to do this the first time. And she said, I don't know, Paul, you know, we send the other stuff. Maybe we'll bug the patients. I say, let's try it, right? And as the appointments rolled in, I said, you want to try it again, Kate? And she said, you were right. So I live to kindly tell people I told you so. But it's because we're kindly annoying people to come in and get the care that they need, get their mouth checks. The pandemic has been nuts, and keep up their momentum, just like, you know, taking your car in for maintenance. So you guys offer so many things. I'm so glad to have you guys sharing. I want to share how people connect with you. Text Intel to 215-543-6454. Proud to have you as a key resource and sponsor. As we wrap up, Raymond, if you could give the audience one thing, you know, one thing they could do now from now to the end of the year to leverage the power of Dental Intel, what have you seen with some of the Dental Intel clients and what they're doing?
I love it. So I wrote it down. Here it is.
Oh, I like that.
Technology do the grunt work. Guys, it's 2020. I see too many dentists and practice owners spending too much time running reports, trying to get data. You spend 30, 40, 50 hours a week practicing, and there's too much to do to manage the practice to go do the grunt work. So we have technology that allows us to be able to schedule patients, that allows us to run reports, tell us our numbers. And so my message is harness technology, use it to make your life easier and simplify.
And it's so important as a practice owner who's media made, sometimes mad, sometimes happy, sometimes this. We just don't have the team with the ability to do all the things we did pre-pandemic. So just nobody really wants to make these continuing care calls and bug people. Let technology do it. The patient's going to be happy because people love getting a text message and acting. So thanks for being here. Really appreciate it. And hang around in the chat and share more about what you do.
Thanks a lot. See ya.
Awesome. So I always like to share with you guys why we're doing this, always be explaining your why. So we have disability insurance, protecting yourself. We have Dental Intel, key resource and sponsor to enhance your practice, to help with the mind and word parts. There's technology available to bring in more patient-centered care, be more productive, increase success, and decrease stress. So awesome there. So I'm ready for our next guest here when they are ready to share their screen. And as we're talking here, share in the chat. We have Bill Ladd. Bill is, and Jared's here too, great. So nothing happens in your practice without money. You know, Mark Costa says, you know, money is the oxygen of our practice. I think dental school doesn't teach us about money. They do a good job charging the money. I think maybe they should do the teaching of how they charge the money, because they tell you, just be a good dentist, so I'll work out. And then you get out of dental school, like, that was horrible advice, right? You guys charged us $500,000. Tell us how you get people to do that. So the money people, dental CPAs, Bill and Jared, awesome friends, key resources and sponsors. Just take a minute to share what you guys do on a day-to-day basis to help dentists in their dentisting lives. I'll start with you, Bill.
Yeah, so if you hold up that basketball again, that's one reason I love talking to you, Paul. You have these analogies that are so cool, man. They just speak our language. You call it the circle of dentistry life. We call it the dental entrepreneurial journey, and every business owner's on an entrepreneurial journey. And you actually opened our eyes that sometimes that starts on day one of D1, right? You know, with people who kind of have that entrepreneurial bent, and the quicker you can start giving good data to those people to educate them on the business of dentistry, the better. So we basically are a CPA firm that understands that everybody is at some point, some phase along that journey. So we built out products, service offerings, and content to try to help them graduate to the next phase. And then to the next phase until they get to that ultimate freedom. So that's what we love doing on a day-to-day basis.
And you guys have shared so much. Jared, you help people a lot of times. You know, you're the people saying, are you nacho nuts to do this money thing? Share with us, you know, it could be a good story, a challenging story, where people at least had my goal is to bring you people who you can put on your advisory team, your board. Dental CPAs, huge part of that. I mean, to learn more about what Bill and Jared do, you can text CPA to 55444. They're great people. But who's run a nacho nuts plan by you and you said, this is good, this is not so good, but just how they didn't know where the money part worked, and share with us a little bit about that.
Yeah, like Bill said, I mean, we help dentists all along the journey. So, you know, one of the phases of the journey, if you will, on a lot of people is like they've identified a practice. Like they're like, hey, here's a practice, I want to buy it. And they just get so married to it. You know, you can't tell them anything different. They're going to take it down, no matter how much money they pay for it. And I think the thing that people don't realize, and things we've seen, is dentists don't really understand the cash flow that's going to come from that practice. You know, what are they actually going to make once they jump in? Are they actually going to make less than what they were making as an associate? Yeah. So we like to really spell that out for them and say, hey, as we see it, this is what the cash flow, this is what you could expect to make off assumptions, et cetera, to basically make sure that that's the right practice. Because not always is that first practice you're looking at buying the right one. We just like to help clarify that is a good one.
I as a broker, I'm a lot of the general dentists. I think of you guys like an endodontist. I think of the dental attorneys as the periodontist. Go to the endodontist first, determine, can we find these canals? Is the tooth restorable? That's our talk, because this is my nacho tip. Don't become overly invested in a practice until you talk to a dental CPA, because sometimes you become emotionally invested and then you have to go back to your spouse, your wife, your husband, someone to be like, I'm going to buy this practice and we're going to make half as much as I used to make. That is something that in a JBR way could destroy a marriage. It could destroy things that are happening, because if you don't have this awareness when going into the biggest decision, buying a practice, biggest decision of your life, bigger decision than who you marry, because I sell practices and I see dentists, multiple spouses, multiple houses, one practice. So what do you guys do if someone's watching this and saying, hey, I want to reach out to you, but I don't know how it works to work with a dental focused attorney. How do people get started on step one? How would they reach out to you guys, Bill?
All right, so not to be a smart aleck, but if they're looking for a dental focused attorney, I'd say
sorry,
Rob
dental
Montgomery,
focused,
my
yeah.
man. They'll send you to Rob Montgomery. If they're looking for the guys with the EBITDA tattooed on their back,
Yes.
then come see us. Go to our website, www.ducketlad.com. You can find a little bit about us, but there's a work with us page, and that's a good resource. I know there's a really frictionless process through Dental Nachos where you can reach out and they can forward that information on to us. And from there, it's just hopping on a call and just chatting to see, is there something we can do to help? And, sometimes there is and sometimes there's not, but it never hurts to at least, see if there's something that could be done to make you better and make your practice better.
And I'll jump in there too. I would just encourage to even reach out if maybe you haven't identified a practice, like you don't need help doing a practice acquisition analysis, but you're just thinking about the concept of, hey, I think I want to be an owner. I think I want to purchase the practice. Reach out to us. We're happy to hop on a call, just educate you a little bit, maybe give you some education resources, books to read, etc. Just really start changing your mindset to business ownership.
For sure.
And one of the things I want to share, because this is connected, I do hopes and dreams calls for dentists. They're very affordable. They talk to me. We go over a practice process, and I'll say, now you need to see the endodontist. Bill and Jared refer you. Share with some of the people that you've met through the Dental Nachos community who've talked to me first. What are some of the things you've helped them with? I mean, I'm here to help people see, like, you've talked to people early in the stage, ownership stage, before it. Bill or Jared, tell us a story, not without don't reveal their names, but who have you connected with along the way, and what have you helped them with?
Yeah, first of all, thank you for sending those. And we do. Most of the ones we've been seeing so far are on the either exploration or the current acquisition phase. I mean, they're ready to buy a practice. Yeah. And, one experience comes to mind, which I thought was really interesting. And that was a guy that you sent our way who, you and I are big believers in getting that mind right and getting the mindset right. And, we started just kind of chatting through, just on the phone call, we were able to kind of identify what kind of practice it was looking at, maybe open his eyes to some things he might want to think about, to consider. I don't think that practice worked out for him, but one thing that I thought was kind of rewarding, and it kind of goes back to what we wish we would have known, was it allowed us to give him some resources to use. I mean, some of them were books, books. Go read this book if you're really interested. Read this, this, and this. These are kind of the Mount Rushmore that will lay a good foundation to get your head right, to give you a general foundational knowledge. And then if you're actually looking at and now, analyzing a practice, come see us again. But in the meantime, here's some homework, get after it. And, I stay in touch with that guy. He's a good dude, and he's going to find a practice. He's going to crush it.
Yeah, that's awesome. Jared, you had similar experiences with dentists you've talked to through the Nachos program.
Yeah, for sure. Just an example, a dentist, maybe, you sent our way and they're looking at an internal practice buy-in. So they've been working there as an associate already, and they're kind of maybe uncomfortable, if you will, like, well, the doctor said, this is the purchase price. Is that a good purchase price? How's it going to work once I buy in? And really, we can jump in, help them understand the numbers, walk them through the logistics, and really kind of help them communicate with that, selling doctor.
You mentioned that. Buy-ins the highest risk and high reward in my experience. I bought in with my dad. It could be a family member. It could be someone, it has high risk and high reward. So it doesn't mean discard it. It doesn't mean give up on it, but it also means to go in with open eyes. So really love you guys sharing. We appreciate it. Thanks for being Nacho Resources. Hang around, share in the chat, but I'm going to just share your text code one more time. Text CPA to 55444 to learn more about what you guys do. And really appreciate it. I'll have a new sports ball here next time. I need a new one.
I'm seeing some comments, Bill, on a country music star, man. You got to whip out the guitar.
Yeah, you did.
That's my Friday casual. I play one on podcast. How about that?
There you go.
I guess I'll reveal my trick. So this is a basketball for the moderator, because I really can't palm a regular basketball. You probably can't tell this on TV. Don't tell anyone out there. 1 billion people are watching. Don't tell anyone I actually can't palm a regulation basketball. Great. Awesome, guys. Thanks so much for being you guys. Really appreciate it.
You bet, guys.
Appreciate it, Paul.
Take care.
Awesome. So see what you are doing here. We're talking about disability insurance, protecting yourself, enhancing your practice. Dental focused CPA is someone you're going to need at every stage of your journey, all along. Whether you buy one practice, two practices, whether you have a buy-in, whether you want to buy a new piece of equipment, that's what you're going to need. So we've met some awesome people here, and now we're going to have on my friend and just an amazing mentor and resource in this community, Dr. Alan Stern. He's just an awesome, seasoned age dentist. He's a SAD. He's not a GAD yet. And Alan, I know everyone knows you in Dental Nachos and what you do, but let's say it's the first time. We got people watching it on Zoom. We got people on Facebook Live. Just share about what you do, because you're our first dentist. We're dental colleagues here. Share about what you do as a dentist and also as a coach.
Well, first of all, I can palm this ball.
That's great.
My daughter was an All-American softball player, so I have.
Cool.
I'm a practicing dentist. I'm almost a GAD, geezer age dentist, golden age dentist. I've been practicing dentistry for 39 years. And I don't know that I've seen it all, but I've seen a lot. And through all the mistakes I made and the triumphs over them, I really realized that I have a lot to give to my colleagues. So I started Better, Richer, Stronger, and that is a coaching service for dentists. And I help dentists redefine prosperity, grow to heights that they couldn't possibly have imagined, just like I was when I was a BAD and an MAD.
Yeah.
I get them through that point in happiness, health, and prosperity, because you can create the practice of your dreams. You can have the life that you want. Dentistry offers that. I don't care what kind of dentistry you're practicing, HMO, PPO, alphabet soup, BAD, GAD, MAD, I don't care. You can focus, you can vision on what you love and actually go in Monday morning and do it.
I love that, Alan, but I'll share it. I love the positivity, as I'm positive, but I also want to be realistic. Without a treatment plan for a patient, things don't go well. Without a treatment plan for your life. And one of the things that I just thought of, the one thing the Nacho team loves besides nachos is all of us are big coffee fans. So tell us about this virtual coffee people can have with you by texting Alan to 215-543-6454, because you've been so kind in sharing your time as a complimentary call pre-coaching. And you've met with some nachos virtually through COVID. Tell us about this complimentary coffee call. What do you guys talk about on that?
This is the stuff I love. And look, for any nacho out there who really needs their eyes open, sometimes all it takes is a cup of coffee, maybe a little of this.
Yeah, right, I like that.
Favorite
Right.
scotches. And we sit and chat for a half hour. And I can open your eyes on any issue. Paul, we all have blind spots. The best of us, the masters, have blind spots. Don't tell anybody, but I have coaches too.
Yeah, right.
There are things that some of us just do not see. The best athletes, the best performers, the best dentists have coaches. Yeah. So if in half an hour, I could open up your eyes to something that you can't see, doors open, they burst open for you, and you can have breakthroughs like you couldn't have imagined. And for a half hour of my time to know that I did that for you, that makes it for me. And if you want to engage me further, that's great. But
Alan, we're going to talk for a few minutes, but what is the website people go to line read directly? We have our text code here for you. What's the best website for people to go to learn about Better, Richer, Stronger?
BetterRicherStronger.com. Email me at betterricherstronger@gmail. And best yet, join my Facebook group. It's very nacho friendly. Dr. Nacho's a member of Better, Richer, Stronger. And we have a lot of great content on there. Frankly, I update my Facebook page more than I update my website at this point. Yeah. You can learn a lot. You could read a lot. We've got great interviews, including one with Paul.
Awesome.
And come and let me help you. Spend a half hour with me. The worst thing that'll happen is you'll make a new friend.
I love that point. And Jim and Tyler said this at the beginning. You can never have, if you're a parent of a 6 and a 2-year-old, you can never have too many good babysitters because you need them. When you're a dentist, you can never have too many good people that care about you, but they aren't emotionally invested in your life. They're not a father, they're not a cousin, because those people's advice is often influenced by their personal relationship with you. So when you have Jims and Tylers and Alan, just to remember back, is this normal? And you've helped people who were afraid of buying a practice become more confident. Some of it doesn't have to be, you don't have to reach out to a coach just because you have a problem. Some of it's saying, what do I want to do with the next step? Does this make sense? Should I move? Should I not move? Running things by people who aren't emotionally invested in your life is such a key to success, because you're going to hear from them, their objective stuff. That's what I do with my coaching. So what you're doing out there, Alan, is amazing. You wrote an awesome content piece that we featured in our email. You share so many good things. Before we jump off, I always like to ask people like you this, and this is what I would ask anyone who wants to get advice from anyone. What would they do differently earlier in their career? They could be happy now. They could have had bumps like everyone's had. They could have high points, but if they said, if I could go back to the future like Michael J. Fox, what would I do different? So leave us with that, Alan. What would you do different or tell yourself early in your career?
What I would have told myself was, focus on my own uniqueness, focus on what makes me happy when I walk into that office, into that operatory on Monday morning. What do I love? And create that practice around my own happiness. We have 3 rights in this country, Paul: life, liberty, and the pursuit of
Happiness. Yeah.
happiness. Pursue your happiness. The money will follow. And then you could hire your accountants to manage it. And you can hire Dental Intel to manage the data. But focus on your happiness, and then everything works for you. And what a lineup you have here. I love listening to these guys.
Awesome. Well, this is what I'm trying to do, Bond, to break down any walls between sponsors, key resources, coaches, dentists, because we're all people at our core, and we can all learn something from each other. And this is our new version of connecting. I can't wait for in-person C to reopen, but we need to still keep connecting. Just because there's not big events doesn't mean dentists don't need to buy new things. They don't need to do things for their patients. Our patients are still expecting the best version of ourselves. So I love that you're a key resource and sponsor, Alan. Thanks for being you. Hang around the show, sharing the chat. Really appreciate you being here.
You got it, Paul. See you later.
Awesome. Thanks, Alan. So see how much you guys are seeing in this business and leadership toppings, whether you're watching live, whether you're watching on demand. One of our prizes, text menu to 215-543-6454. You'll get a course on how to present dental care. So we can bring up our next guest whenever we're ready. And you guys also share questions in the chat. The Nacho team is here to help you answer them. We can't answer them on the show live. They'll get you to the right person. If you're watching, and this is the first time you scrolled by Dental Nachos ever, anytime you email salsa@dentalnachos.com or text salsa to 215-543-6454, a member of the Nacho team, we're back to help you. So our next guest on here is going to be talking about marketing and 1-800-DENTIST, how we can get more of the patients that we want to be in our practices, how we can share our story. One of the things that I really have a problem with dental school is they don't teach you how to get the patients into your office to do the things that you want to do, whether you want to do them to make money, whether you want to do them to help patients, whether you want to do them to keep the lights on, all of those things matter. So I am here with Kevin Gwinnett, Director of Sales for 1-800-DENTIST. Share with us, Kevin, what you guys do and how you help dentists.
Excellent. Thank you, Paul. Great show, by the way.
Thanks.
Very, very enjoyable. So yeah, thanks for inviting me. What we do basically with 1-800-DENTIST is we are marketing very heavily all over internet, do SEO, social media. We're reaching out to the general public, and what we're trying to do is, we're trying to educate people on the importance of seeing a dentist on a regular basis. We've been doing this for about 34 years. And what that does is it prompts consumers to contact us, and they get to speak with a live agent. And what we do is we're trying to find them their new dental home. So our agents will pre-screen them based on dental need, location, how they're going to pay. And then we'll appropriately match them to the dental practice based on a unique profile we'll build about the practice in our system that is the right match for that patient.
You're new to our Nacho Play. We have a JBN, Just Be Nice motto, and sharing and caring. And I think you guys just sharing that you should see a dentist is so important, because I always say this, whenever I watch the Super Bowl, I see a commercial about pistachios, and I say, who are the pistachio people paying for this commercial? I'm sure farmers and stuff say, hey, we got to get our word out that you got to eat pistachios. And I believe dentistry, it's so important for us to do that. One of the positive parts of the pandemic for dentists is, as we go through this, is nothing happened to teeth. And we probably could make an argument, people snacking so much use their teeth more. But during this time, there's industries that have been very disrupted by the pandemic, and they're going to have to adapt and do different things. Will we have as big as weddings? I don't know those things. But dentistry, I've been back to doing dentistry since May. It's still the same dentistry, right? People still come and have work done. And I think it's actually highlighted a lot of the reasons why I go to a dentist. Could you share with us a little bit about the experience you guys have had over the pandemic with, have you had more calls, less calls, some of the things coming in for 1-800-DENTIST?
Sure. Our call volume has been very consistent of people looking for a dentist. However, the pains that we're finding with my team talking to dental offices during this pandemic is really right when dental offices were able to reopen and treat all care, their hygiene skills, they surged, and they were trying to get all their regular patients back in the door, even though they were limited and only seeing maybe a couple patients a day, which, caused a lot of stress with the dentist. But now we're here in October, now the hygiene schedules are empty. So we're talking to dentists who are panicked right now. Their hygiene schedules are empty. They're trying to find how can we get new patients and fill those chairs. And they're also frustrated because I think they're mentioning over 20% of their original patient records aren't even coming back either, because with this pandemic, people are scared to go into
For sure.
care.
I think I want to share how people can reach out to you guys. Text 1-800-215-543-645 to learn more. Hopefully, one of the things I've talked about, you might have seen in the beginning of the show, was our dental core, how to work on your mind, your words, and your hands, and also have a good heart. So the mind part, I mean, I will share authentically that there's been times where I've been cheap on marketing, where I haven't dedicated enough to marketing in all different ways, whether it's Google searches, 1-800-dentist, pay-per-click, newspapers. And I've regretted that because we constantly need new patients. And I've seen through this pandemic, even around us, that people are looking for new dentists for a variety of reasons. As a practice broker, some practices have closed down. They've retired. It's not the end of the world, but small practices have closed down. How could 1-800-dentist help people like that, Kevin? And how can they reach out to you guys directly to learn more about what you do?
So how we can help is because we get such a consistent volume of calls and we're a 24-hour operation, we have a consistent flow that we can refer new referrals to a dental office month in and month out. And we want to help fill the holes in their schedule, the holes of the appointments that they've lost throughout this whole pandemic and going on from now to the end of the year. We want to help them out through the end of the year, get them set up right, and have them be successful going into 2021.
So important. I think being prepared and aware. No one knew this was going to happen. I've been a dentist for 18 years. I never thought dentistry would be grounded like me as a child, and I couldn't do it. So, but you know, there are things that if I knew this was coming, there's things I would have done to prepare for it differently. So let's take this time to learn from this experience of dentistry and do this. So I really appreciate you sharing, Kevin. I'm excited for you guys to share more. Is there anything else you'd like to share with the audience before we jump off?
Absolutely. So right now, also to really boost practices and help them the best, we're also offering 40% off all our fees the remainder of 2020. And my direct contact, anyone can contact me by email. It's kgwinup@futuredontics.com. So that's KGWINUP@futuredontics.com. That's FUTUREDONTICS.com.
That's awesome. And I you know, the dentist people, our dentist people, Kevin, they love a deal, not on their crown preps, but on their other services. So you get them with the deal, a coupon. The dentists like that. They love the Bed Bath & Beyond coupon for life. So awesome. Thanks so much for being and sharing with us here. We'll have you back on future shows. Team will share in the chat. Hang around and share in the chat. Really appreciate you contributing to our Nacho community.
Fantastic. Thanks for having me.
Awesome. So we've learned so much here so far. This has just been an awesome show so far. We have other great guests coming up. So about disability insurance, dental intel, CPAs, coaches, 1-800-dentists. And now you're not allowed to have favorites, but I have some favorites in my life of things. So some of the favorite things I have in my life. So I would share my entire life. I try to keep myself outside the circle of annoyance. Annoyance on the inside, me on the outside. One of the most annoying things I've ever dealt with in my life is the material alginate. I never understood it. You take this impression and you have to rush like a NASCAR race car driver back to the lab to pour it up. If you forget and it dries up, it's done. If you pour it up and the model breaks, it's done. As a new dentist in practice, my biggest concern was being confident in my patients trusting me. They didn't trust me when I had to call them back after the night guard model broke. So I want to share this story. I said, I don't want to use it, but my dad said he can't use regular PVS. It's too expensive. So I bought 1,000 cartridges of inexpensive PDS from a lab that was going out of business. Not a joke. It was purple. It was at the office. Then I met Keaton-Bach and they had Silginat. And I said, we're never going to use an alginate again. And even my own dad, who was amazing, I practiced with for 11 years till unfortunately passed away a few years ago. The end of his career in life, he was using it because he got it, because he didn't want to have a patient come back after a model broke or have an assistant have to run and do this. So we're here with Dan Perley of Keaton-Bach, who's an amazing supporter, kind key resource and friend who sells many things besides Silginat, but I just want to share that story on the show. Thanks, Dan, for being here. Tell us what you do with Keaton-Bach for the Nacho community and the dental community at large.
I don't know. I think I'm done. I think you did everything here. No, just kidding. And Keaton-Bach, to those that don't know us, we're a German manufacturer. I happen to represent the U.S. business, which is some 36 of us stretch coast to coast, office located in Huntington Beach, California. But here I am in Chicago, where I make my home. It's cold, it's miserable, it's rainy, it's nasty. I should be in Huntington Beach.
Yeah.
COVID is keeping me from there. So here I am.
And
We're a direct selling company. We sell all of our products direct into your office. And by that very simple act, we save you at least 30% on the cost of your dental materials. We have, besides Silginate, which of course Dr. Goodman is a big fan of, Panasil impression material, VPS impression material, known for its great clinical productivity in that it gives you all the work time you need, but it sets very quickly in the mouth. So you're not keeping the patient waiting. You're not keeping your staff waiting. You're not keeping yourself waiting.
That's awesome.
It's very efficient. And then, of course, we have a newer resin product line, temporary material, and Semcor, our newest adhesive cement, which doubles as a core material. These are all materials that are made with our technology out of Eschenburg, Germany, and brought directly into your office.
And you've done something, Dan.
Paul,
Well, pretend,
I
Dan, I drive. Oh, yeah. I like it. I love baseball. We're gonna get all sports things. I love this, Dan. So I drive a hard bargain because another dream came true. Not dunking. That's still not come true. I have to jump off this ladder. But Dan has made us a buying group. So I always wanted a buying group. Text buying to 55444. So now, at no additional cost for the free group you're already in, which is also no cost, you can be part of the Keaton Bach buying group. And one of my friends on the Facebook group said yesterday, because you know your dentist people, tell us about, because he said, Paul has negotiated a great deal. I had to buy a lot of stuff because you're giving, tell us about the machine that they can get.
Well, you can get the machine free. All you have to do is buy about $1,000 worth of product and you get the machine free. And it doesn't matter what product
I negotiated such a good deal, Dan. He had a hard time getting up to $1,200. So I've done it for our community. You know, save on impression materials. We use Panasil too. I know I always talk about Silginate as my favorite, but we use multiple Keaton Bach products in our office. But whether you're using it for Silginate, for Algin Alternative, Panasil, the core material, the temporary material, other things that this is the benefit of being a part of a community. You can save money from our key resource and sponsor for ordering the same stuff. You can decrease annoyance by not having your assistants have to pour up Alginates anymore. And you can increase success and decrease stress. I appreciate, Dan, everything that you do for us. Before we jump off, is there anything else you'd like to share with the Nacho community about Keaton Bach?
Only that we're easy to reach. I've got plenty of field representatives, as I said, coast to coast, or you can simply call us 877-532-2123, or visit us on our website, kettenbach-dental.us. Either way, reach out to us. We're happy to work with you. Each practice has its unique needs and we flex to your needs. So we're very happy to work with anybody that doesn't know us. We'll spend whatever time you need.
Yeah, you guys are just a class A, classy organization. We appreciate having you. Thanks for all the things you do. And Dan did really buy me 9 cars. 9 Matchbox cars. You made her day. So now I can finally say a sponsor has purchased cars for me, 9 of the Matchbox cars. Thanks so much, Sam. Really appreciate it.
You bet. Thank you.
Awesome. So as we just roll along here with business and leadership toppings, this is the whole part of being a dentist, to increase your success, decrease stress. Don't cry so much on the inside. This was me in 2004. I was crying inside like 42 times a day. It went down maybe like 20 times a day. The pandemic did bring it up. The temperature check bouncers, it was quite a thing. But now I'm back down again. So I'm ready for our next key resource and sponsor. One of my favorite things out there for dentists to do so we can promote Nina whenever she's ready. Some of the things that I'd like to share with you guys watching in, and this is the cool part about being Dr. Nacho, I get to learn about things I didn't even know were a thing a year ago. So I've been a dentist for 18 years and I worked in my dad's practice as a child and I saw slips going to insurance, super bills, T-bills, write-offs, adjustments. I didn't know you could outsource your annoyance and have other people do that, delegate your annoyance. Well, you want to pay attention to what Nina Bond and Dynamic Dental Solutions does. because they can outsource your insurance annoyance, give you more time with the patients. Welcome, Nina, and share with our community what you do, because I think it's so important for the decreasing of annoyance. Tell us how your company works.
Sure. So we remotely manage your AR, insurance AR, and patient AR process, which can help tremendously, as you know, and just said, in the dental practice. I mean, we have professionals with experience that know the ins and outs of the dental insurance industry, and they can really help the practice increase their cash flow.
And I was sharing before, Nina, there's one of my favorite comedians, Gary Goldman, always says, you know, if you find a $20 bill in your jacket, you go to Chipotle and you get the extra guac, like, you know, you're rich. But we have all this AR from insurance, right? Share with us, even good offices, you know, what have you done for them over the pandemic and before, where they say our AR is pretty good, but see what you can do, Nina, because we can't collect these things. Tell us about some of the things you've done.
Sure. Yeah, we've had a current client mention that we're a vital organ in her practice. She cannot function without our help. We help train front office staff on dental insurance. We help get difficult claims paid that maybe otherwise wouldn't be able to get paid. During COVID, we really focused hard on bringing in revenues for practices that were shut down. They might have had 30, 40,000 sitting on their AR. And while they were shut down, they were able to bring that money in as a source of income while they weren't producing.
Yeah, I mean, and that's so valuable, because we all of us, whether you had a practice that was doing $5 million a year, $500,000 a year, struggled through months of having really no cash flow come into your practice. So when you can leverage your AR, and also it's just one of those things, it makes you feel better when you get paid for the stuff that you do. Because dentists contact arts and crafts. Like when you think about that patient and pay for the class 2s, it's how you feel on the inside, is like this guy. So just what you do is this vital organ thing. It's great. I want to tell people, you know, get a JFO consult, text billing to 55444 to learn more. But I'm so passionate about getting dentists to JFO about this. How does it work? You know, take my office, I call you guys up, I connect with you. What's the process like to work with you guys?
So we obviously get a connection to your practice management software, and we have our billing professionals dive in and start investigating what's happening in your billing process. And all of our great minds put together say, okay, what can help this practice? What can get them on the right track? What can increase their cash flow? What are we seeing here? What are some issues that we're seeing? And we go in and we fix them. And we systematize the process. So you're generating this awesome cash flow every month, and you're actually collecting on those class 2s.
And one of the reasons, you know, when you run a team meeting with hygienist assistants, front desk, and dentists, when I say, hey, we're going to talk about implant kits, the front desk go, okay, now it's time for me to zone out and, you know, not pay attention. But I say, no, you got to pay attention, because you have to help. And that's why it's great. I see some of our key resources and sponsors. You're a dental CPA and you don't know someone like Nina Bond exists. Now you can help your client make more money by doing this, because they might have and say, what's your AR like? And if it's 3 times what your monthly production is, that could be way out of back.
Yes, I was actually listening. I've been listening for a while, and that's something that I was thinking about. You know, a lot of our practices could really do well with an accounting consult with the CPA that, you know, really knows the back end of things. While we're bringing in the revenue, your CPA is working on the back end, make sure you're maximizing that revenue and how you can use those funds. So
it's a key part of having the right people on your team and needing them at the right time. And, you know, I'm going back to the gym more often. You probably tell, because I'm totally jacked now. But, you know, I went back, and I'm someone who's always been active. And I said to the person running the class, I'm like, I haven't been, you know, really working out in a while. He's like, wow, you know, you can do a lot of push-ups. But then when it came to flexibility, I'm not very flexible. So sometimes you don't even know what you're not good at in a practice. You know, sometimes you think, I don't get enough new patients. And someone like Alan Stern will say, you get plenty of new patients, but your staff cost is too high. So that's why we're here doing this, to help everyone with their core and figuring out how they can strengthen this entire thing. So I love what you do, Nina. I think everyone should do a JFO consult with you. There's no doubt.
Great, yes.
Before we jump off, how can people connect with you? And is there anything else you want to share about Dynamic Dental that we didn't get to?
They can email us at contact@DDS Dental Billing. They can text us billing at, what was that, 555?
Yeah, text billing to 55. See, look, I made it so easy. You only have 5 numbers. Just
55444. You can text billing and we'll be in touch with you. You can call our 888 number, 888-908-8225. And when you call, you can ask for me directly and I'll be more than happy to do a consultation.
Awesome. I mean, I just love that. I mean, I think this is what our community needs, is just to know about resources to decrease stress, increase success, and also decrease stress of your team. I mean, we're all part of this family. You know, when you say my staff's a family, I say, well, I argue with my family sometimes. Take away some of those things. Maybe you don't realize that you've put too much on someone's plate. I've done that before. You know, I put too much on someone's plate. Probably my nacho team is nodding at their computer right now, and my dental team is too. But just because I don't know how long these things take, or I don't know that you had to
We definitely create a bond within the practice and the front office team and the back office team. You know, they're like, thank you so much for helping us. You know, it's wonderful to have you part of our team and just knowing where there's a place to go to and someone's there to help.
Yes, so. I love that. So thanks, Nina, for being a key resource and sponsor.
Sure.
Friend, and have a great rest of the day. Appreciate you sharing.
Thank you.
Chat. Awesome. So we've had just so many amazing things. Everybody just here offering ways to increase your stress, increase your success, decrease your stress, build your dentistry core, all the things dental school did not teach us, but is essential to survival and thrival, and most of all, not crying on the inside too often. So our next key resource and sponsor, someone who I met in person before the pandemic, has come to Nacho events. And really, you know, there's a golden retriever of what people do. Bringing in the people to do the cases that you want to do is a big part of that. So we had marketing with 1-800-DENTIST. There's so much opportunity for marketers to connect with our community and win. There's an opportunity to develop your niche and what do you want to share with patients through video, through Facebook. So I want to welcome Shane Simmons, founder of Crimson Media. To reach out to Shane, you can text 55444. Shane has gotten to know me over the years. We've met in person. The Nacho community knows him, but Shane, share with our community what you do and how you help dentists.
Yeah, no, thanks again for having me, Paul. So, you know, basically our whole goal is to help dentists build the type of practice that they envisioned maybe when they went into business ownership. And you talked about it earlier in this live session here. You know, in dental school, you're taught all the ins and outs of the clinical side of dentistry. Krebs cycle, of course, you can't forget that. Yeah. I'm not a dentist and I know about the Krebs cycle listening to Paul enough. But what you're not taught is how do you actually bring those patients in that are, you know, going to allow you to do the type of work that you're passionate about and build the type of practice that you are, you know, happy to go to work to every day and not have a lot of, you know, nacho tears, so to speak. So what we do is we help bring those patients to your practice through what we call omnipresence marketing, where we help you become visible, and not only just visible, but in a way that shows patients that you're the right practice for them.
And also what I like, Shane, is, you know, if you said to a dentist, you're going to have $4,000 of production tomorrow, you like that? They say, yes, it's 20 class 2s. I don't like that, right? So it's also the type of the work that you're doing. And I like that you share wins on the groups about your clients. Tell us about some of your clients who have just done some cool things over the pandemic, whether it's capturing more implant cases or sleep apnea, and how they're excited to share that with you.
Yeah, so, you know, obviously this year's been a crazy year, but we have, and I'm really proud to say this, a large number of clients who are on track to have a record year in production, even with the shutdown. So for example, October, I know a lot of people's schedules, you know, look pretty bare and minimum, and that was totally normal, but the clients who've been working with us for, you know, a year or 2 years, their schedules have been packed throughout the month of October into November, December. And so you can go out there and you can, you know, be ultra successful, but as they say, you know, Rome isn't built in a day. And so that's the same thing with marketing. There's a lot of, you know, get rich quick type schemes out there. And if it sounds too good to be true, it probably is. What you need is to develop and build a solid brand, a solid name through an omnipresence online, start funneling patients in that way. We actually had a Nacho member just yesterday I was emailing back and forth with, and we were talking about some of the different things that we were doing. And he said, hey, you know, just wanted to let you know, between these emails, we just closed a $12,000 implant case paid for in the office in between our emails here, and they found us on Google. So that's the type of production you can create. You can create those happy cases in your office for the team, profitable cases, but you got to have a system in place, and that's what we help you with.
And I'm, at the end of the show, I'll share a couple of videos. And I think you saw my implant video from 12 years ago. The person found me on Google. You didn't have a business at that time. We used a type of pay-per-click marketing to capture that person. So it's the same things, whether it's a Crimson Media, the 1-800-Dentist, the Jamie DeBeast, is just awareness of what you're doing. So you bring these patients in, and then you're able to help them in a way, and more work on fewer people is the theme that I've been telling the residents about for a decade. Dentistry isn't going to be 4 root canals, 4 crowns on 1 patient. It's going to be a lot of maintenance and then a lot of opportunity to change people's lives. Have some of your clients, Shane, actually taken extra implant training because you brought them implant patients? I think that's something that dentists would really like to hear. They built their own implant cases through that.
Yeah, so a couple of examples of that. We have a startup practice who it's going on her 1 year of being open, and she is basically a baby age dentist. And she has, we started doing some implant marketing for her, and she was just placing some single implants and that type of thing at first, but she started getting a lot of full arch cases who were needing work done, and she was referring that out. She said, well, I want to be able to keep this here in my office and do this myself. So she's since been taking courses over the last several months so she can do some more full arch cases that we're bringing her from her marketing. And over the last, I think it was 2 months now when we ran the report, she's closed over $40,000 in implant cases. And this is something, she's super passionate and excited about, and it's obviously taking her startup to levels that, she did not foresee in such a quick matter of time. Second client, been practicing in his private practice for about 3 years since he purchased it. And it was kind of the same situation where he's getting a lot of patients in the door. They're doing record production numbers. He says, it's time for us to start bringing some of these implant cases in-house. So he's actually brought in an associate periodontist to come into his office a few days a month and start closing and placing some of these full arch cases that we're bringing in his practice. So it's one of those things where maybe you're not doing it right now and you just need some general patients in the office or some general emergency marketing. Whatever it is, we can help you out and help you bridge that gap to where you want to be in the future, but it's never too early to start.
I think it's just a great message. You're, great Nacho, Shane. You embrace everything we do in this community. I want to share again, people can text Crimson to 55444. You've been working with people, helping. And when it's legal again, Shane, you'll come back to Philadelphia for more Elvez nachos.
I can't wait for some Elvez. I've missed it.
Awesome, Shane. Thanks so much. Have a great rest of the day.
Thank you. Thanks, guys.
So I hope what I'm sharing here as we wait to bring up our next key resource and sponsor is that, we're trying to manage and eliminate the cave mentality. How can we connect? One of the things we do to do that is to text job to 215-543-6454. You text it right now, you'll get a list of our 40 plus open positions at Dentist Job Connect and how you can list your position or find a job. You cannot pay off your student loans without a job. You cannot build the most beautiful emergence profile in the world without a job. So take advantage of our Dentist Job Connect program to learn more about what's out there. So I'm excited for our next key resource and sponsor who got a lot of attention during the pandemic time because, for decades, hygiene, we have had Cabotrons, we've had improvements in instruments, but that became a huge deal during this pandemic time. What are we allowed to do? Can we do this? Can we not do this? So what does PDT do in helping dentists? We have the awesome Linda here with us. Linda, you might be sharing your whole screen. You could just do your video and stop share. You're welcome to share if you'd like. If you have anything fun you want to show us. But if you hit stop share and then just put your video on, I think we'll be able to see you. As we wait for Linda to come on, PDT, they've actually have a whole hygiene kit called the JVN kit. I'm very proud of that. You can text PDT to 215-543-6454. If you're going to bring up like a nacho recipe, Linda, I would have liked that on your screen, so you can always share. But thanks for being here. Really glad to have you. I think it's cool to just take a minute and share with us, what has happened with hygiene instruments, what PDT does, and how the pandemic has been for you.
Well, thank you so much, Paul. I'm very happy to be here. This is very exciting for us. PDT is Paradise Dental, and we really focus on people to keep you and your staff healthy and efficient and effective, and to keep your patients more comfortable through your procedures, with the use of ergonomic and anatomically correct instruments.
And one of the things you have, we have in the JBN hygiene kit, I know Ariel picked out one of her favorite instruments, the Montana Jack. I think it's fun when you have fun names for stuff. In the beginning of this, when we talked, you were, hand scaling has taken a front seat again. What are some of the instruments? Do you have instruments that don't need to be sharpened as much? Tell us a little bit about that.
We do. And, PDT, that Montana Jack is our #1 selling instrument. This grip, it's ergonomic. We worked with orthopedic surgeons and physical therapists because so many dental professionals have hand, wrist, shoulder, neck issues. And a lot of that's because weight's residual in your tendons and ligaments, and also how you have to adapt instruments. And so I love to listen, watch, observe. And that's one thing that you might do as a dentist too, is observe some of your staff. If they are trying to adapt an instrument, it's something for you too. If you have a patient that you're trying to get in and do some surgery on, this is a scalpel handle that actually adapts to different angles. So you're not standing on your head, you're not, pulling.
I want to say, Linda, because I have this thing, and we're going to order some more for our company, because there was a, even this thing like, for your hand, for your cell phone, when this thing falls off, I don't like it anymore. So even if you might not think you have a problem, but something could be better, and something you hold every day as a hygienist or a dentist is so critical. I mean, I think that's such an important point, and that fits with our theme of your mind, words, and hands, because you're protecting your actual hands in this process. I just love that, you guys are creative in doing that to make, really our day-to-day chairside lives less stressful in what we have to do. Share with us what else is coming up for PDT in 2021, or if people are watching in, this is the first time they heard of you. What is something that they should know about Paradise Dental?
Great. Well, PDT is an independent family-owned business, just like many of you. Through these trying times, it's been trying for many people. It's been extremely important to have a team that works together, and we are there to work with you and work with your teams. Our hand instruments, we service people all around the world. We started my 2-car garage, and people loved our instruments so much that now we're in 57 countries, and amazing. People don't think about their mirror hand that much, but how many of you have, pain in your thumb? This is an amazing idea because we worked with engineers on that grip. It has a mobility probe on the other end. So many things. Our resin instruments are explorers and diagnostic. It's resin, so it resonates into your fingertips, so you have much greater tactile sensitivity. Shane was talking about full arch, and boy, when you have those full arch cases that come in and they need maintenance, well, the hygienist will seat them, and then you have to come in and take off that full arch. We worked with Dr. Pinheiro, Alfonso Pinheiro, who is a prosthodontist, and we now have instruments that you can leave that full arch in place.
Great. We need to order those for our office because we have multiple fixed hybrid cases in our office. That's really outstanding.
Oh, that saves you so much time. It really.
Also, I just want to share, maybe people who do some implant work, every time you remove one of those cases, you're always worried you're going to find some adventure, like a thing, and you regret. You're like, I shouldn't have done this, but you want to clean it. I think that is awesome. I mean, I'm so glad to have you guys on board sharing with us. Text PDT to 215-543-6454. One of the things I'd like to kindly annoy and encourage the community to do is, set yourself up for success in 2021. And if you start a hygiene day and your hygienist doesn't have enough kits to get through the day without sterilizing any, I think that's nacho nuts, because your sterilizer could go down, things could happen. We don't have the team. Hygiene visits at $200 to $300 a visit. Don't put yourself at this weak point of, oh, we need to re-sterilize this Montana Jack. So I know I'm going to be buying more hygiene instruments for our office because, we might have had people sterilizing stuff and they don't work at the office anymore. We don't have people coming back. I mean, I think it's a really good opportunity to get your team less stressed, more successful, and ready for their day.
And the JBN kit is amazing. This is a kit, just be nice kit. If you don't have enough instruments, this is something that Paul and Ariel joined with us to create. It's an amazing kit that has all of your hygiene needs in it for those perio patients or for a standard prophy.
I love that.
And the cassette is so easy.
That's what I want. Open up kit, do hygiene, have everything there, your mirror, everything. Buy some. PDT, I'm sure, is going to be running some awesome specials and opportunities for you guys to connect with them. So before we jump off, Linda, we have our text code, but if someone wanted to reach out to you directly or visit your website, what would be the best way for them to do that?
Sure. Our website is pdtdental.com, and we have the whole array of instruments for you, and they're ergonomic for you as the dentist as well as for your hygienist. And our phone number is 800-240-9895. And if you want to connect with me personally, my email is linda.miller@pdtdental.com. And we have a terrific customer care team. That's customer.care@pdtdental.com.
Awesome.
And great specials going on right now with your Just Be Nice kit. You also get a free composite instrument, and then we have a 5+1, so you get an additional instrument with it at no charge, and a 12+3 for new.
I like that. Get the JJ kids. Think of Ariel and Paul every time you do a cleaning. That'll be, in your office. You get nachos for lunch. Thanks, Linda. We'll have you back on for stuff. I really appreciate it.
Thank you.
Awesome, guys. So this is what we're trying to do in the Dental Nachos community, bring you this way of learning about companies, learning about people in a fun way, in a lean forward way. Maybe some of you sitting on your couch, just having coffee, wine, maybe you're having both, so that you can do this. I am a huge fan. Get back out for in-person seeing exhibits, but until that happens, we need a way to bond and connect. You also can get a recording of this show to share with your team. So whether you're a key resource and sponsor or someone watching and said, oh, I want to remember what the dental CPA said, or what 1-800-Dentist said, or what this person said, just text Business and Leadership Volume 5 to 215-543-6454, or email Business and Leadership Volume 5 to Flix, F-L-I-X, @dentalnachos.com. We'll give you a recording of the show, key resources and sponsors. You want to share that you're on the Nacho Network. Maybe you want to watch this instead of Netflix tonight. Maybe your spouse would like watching Business and Leadership Toppings. Try it. Maybe it'll be just as good as Schitt's Creek. I'm just joking. I'm probably not as good as Schitt's Creek. But we're going to bring up our next guest on the show. I'm actually interested to see if he still has his pandemic beard. So when Scott is ready, we're going to bring him up to share with us. Oh, so look, I didn't see him from last night. So you got no, just like
beard is gone.
Yeah, just so you look nice. It's, I like it, Scott. So Scott is going to share with us what he does. I have to say, Scott was one of my last pre-pandemic outings before it was to Elvez, when it was normal to sit at the bar of Elvez. So he was here in Philly, and we met for that. But Scott, share with the community, for people who don't know, what you do, your dental life, and how you guys help dentists.
Sure, and how times have changed since that Elvez was in February, right? I am a periodontist by background. I practice about a day a week. Don't have my own practice, but I work at a few different GP offices. And I spend the vast majority of my time working on Supply Clinic. So supplyclinic.com is an online marketplace for dental supplies. We host over 100 and some odd authorized sellers of different dental supplies, all on one platform. We make the shopping experience super easy. And the beauty is, on any given product page, you can see which seller sells that item at what price. So it's transparent price comparing right on the spot. You can add to your cart and check out in one cart with one payment processed, even if from a number of different sellers. So
love that, Scott. We're going to talk about some fun stuff. I want to share your text code before we get started, so we can text and connect with you. So this morning I was talking to 100 dentisting humans in multiple offices about patient communication. I asked them, what is their biggest annoyance? What's their challenges? If I could wave a magic wand. And I got supplies. And one of the things I said as a practicing dentist is really expand your network of vendors, right? I know previously people think, I only use supply company A. This is who I use. I know the rep, blah, blah. I only use B. But now, since we need gloves, we need PPE, it's the time for us to bond together and expand our resources and look to a variety of vendors to get the things we need. Tell us a little bit, because you're on the inside of supplies, just share with our audience some of the things that have happened over the pandemic, the supply chain, what we can't get enough of, what we can get more of. I just find that to be interesting. And I'm also, concerned myself as we move forward,
Sure.
we have enough stuff. Tell us
Yeah,
a little.
absolutely. We've definitely been through a bit of a roller coaster here. And I suppose if we walk back to the middle of March, we saw, huge shortages for hospitals that had to treat COVID patients. And we had many individuals in the dental community were super generous and donated their PPE to their local hospital or health center, and then found themselves up Schitt's Creek in as much as they didn't have the PPE, it wasn't available, and then when it became available, it was like 5 times or 10 times the price that they had originally bought it from pre-pandemic. And so we've kind of gone through different waves of challenges with different SKUs or items of PPE. The first challenge was masks, and that's sort of settled a bit. The next challenge was gowns, and I think we're through the worst of that. What we're seeing now are some challenges with gloves specifically and disinfectant wipes specifically. And so part of the beauty of the product that we built as a marketplace is we have many sellers that sell these types of products. And so we have built-in redundancy, whereas if one seller runs short and goes on back order, we have a number of others that hopefully can get those supplies out to the greater dental community.
And I think we know this is highlighted, we just had Lynn down about hygiene, is that some of the things that we thought were kind of boring-ish in our world have now become very at the forefront of being complex, because, I never thought we'd run out of diapers. And if I did with a 1 and a 2-year-old, that's a problem. If you're a dentist and you run out of gloves, no matter what else happens, that's going to be a big problem. So I think suppliers like you are really doing a great nacho job for just creating more awareness of what dentists should have been doing prior to it. And if stuff doesn't expire, we try to get extra. I mean, you don't want to be caught without getting extra. You were on our show early in this and said, hey, go to different suppliers and get what you can of this. So I want to now shift gears to a fun thing. I know my nacho people, Scott. I know my dentist people, you're one. They love a deal. They love a contest. And they especially love if there's a chance to get free stuff, a lot of free stuff. So share with us what Supply Clinic is doing to have a fun contest of free stuff for our community.
Absolutely. So we at Supply Clinic are teaming up with the Dental Nachos community, and we've put together a raffle that'll take place around around the holidays, so end of December, exact date to be determined. And we are looking at raffling off a grand prize of $10,000 worth of supplies.
People are going to love that. $10,000 in free supplies. You're a practice owner. You're going to really start your year off with great EBITDA. Bill is still here. That's great EBITDA, right? $10,000 towards EBITDA. So $10,000 of supplies. How can a Nacho member participate in this?
Sure. So 3 super simple steps. So one is you got to be a Nachos member to have a chance at winning that grand prize. But assuming you are a Nachos member, the first thing to do, the first way to get a ticket is to go on supplyclinic.com, create a cart. It's got to be 10 items. It doesn't matter the value of those items. So the overall size of the cart doesn't really matter. And at checkout, use the coupon code Nachos Raffle. So that's NACHOS RAFFLE, Nachos Raffle, one word, and get $20 off of your order, no matter the dollar value of that order. So we are effectively paying people to get a raffle ticket, Nachos Raffle, that's right, to get that first raffle ticket to be able to have a chance at winning that $10,000. Anybody can then increase their chances tenfold and get nine extra tickets if they take one more step. They go one step further and email us at nachosraffle@supplyclinic.com with a purchase order or an invoice from another company that they order from, doesn't matter what company, showing us that they saved shopping on Supply Clinic.
Oh, nice.
So simple email, purchase orders, send it our way, and get 9 additional raffle tickets for a total of 10 tickets for a chance to win the $10,000.
That's awesome. So let me just break it down. So
Sure.
First, you just get a $20 coupon. Go on supplyclinic.com, use the code Nachos Raffle. You're going to save $20, put 10 items in your cart, get yourself gloves, masks, stuff you need, lidocaine, or new stuff that you have. You have a cool site. So that gets you 1 raffle ticket, and then email in an order, a purchase order from any other Supply Clinic, any other supply company, showing savings. Is that right?
That's exactly right.
Awesome.
All they got to do, and you know, we want to be here for the community. You know, use it for the PPE that you're having trouble finding elsewhere, or for, you know, we have 50,000 different products on the site for, you know, whatever you need.
And this is the time, expand your vendor awareness for the stuff you need to survive and thrive as a dentist. I didn't think we'd be here, but we're here. I've been a dentist for 18 years, a practice owner for 15 years. I didn't think there'd be a time where it says you cannot buy enough masks, you cannot buy enough gowns. So use this time to prepare for the future. There might be something else that happens. So, you know, what you guys are doing is awesome, Scott. I'm so proud to have you guys as a key resource and sponsor. I especially love you're making it fun here with this raffle. So someone out there is going to win $10,000.
$10,000.
We're going to have secondary prizes for fun too for people. So get those 10 raffle tickets by going on supplyclinic.com and using the code Nachos raffle at checkout to save $20. Then emailing in, well, our Nacho team can help you with this too. Emailing in purchase order showing savings and get 9 more tickets. That's awesome, Scott. Before we jump off, anything else you want to share about Supply Clinic, not having a beard, the show Schitt's Creek, if you watch it, anything else you'd like to share with us?
It's weird not having a beard. I had one for 6 years and then shaved it off because it's, you know, the N95s fit a little bit better with without the beard. But yeah, no, otherwise we're just super excited to you know, reach out to the community, get the exciting raffle program going and help out as much as we can. So we've got an awesome team here that's on the Supply Clinic side that's also excited to help out the Nachos community. So we're all prepped and ready to go.
Awesome. Well, I love it. This is time for us to bond together as a community, do more fun stuff, get ourselves set up for a great 2021. $10,000 in free supplies is the ultimate JBN. So we really appreciate it, Scott.
Our pleasure.
Awesome. All right, guys. So we've got an awesome show. We have our last guest is so cool because he is going to share how he helps patients watch TV, and we're on a TV show. So I like this part of this to wrap us up here. How can you watch TV while you're at the dentist, watch entertainment while you're at the dentist? And after this, well, we can bring some of our key resource sponsors on for a wrap up, but I want to bring on the show next, Casey from Moeller Media Mount, who is going to share with us what he does, 2 things to make the dental visit more fun for your patients. Also, he's done something super creative to help dentists protect themselves from splatter, an alternative to a face shield. As we wait for Casey to share his screen, I want to remind you that you can text job to 215-543-6454 and learn about all our Nacho jobs out there. You can also text menu to 215-543-6454, and you will get a 60-minute course on how to present treatment, as well as our Dr. Nacho yellow financial agreement form. Casey, thanks for being here. We got another dentist on the show. You know, Scott was here, Alan's here. We're representing our people well as dentists and entrepreneurs. Tell our group what you do as a dentist and also with your company, Moeller Media Mount.
Well, first I have a couple. One, I was ready to share my whole screen with my nacho recipe and some like some hydrofoiling videos, but I just got a new like MacBook and it was not, the setting wouldn't let me do it.
Next time I need the nacho recipe next time.
I know. So yeah, and then I do have a few questions up front. Well, first, like this whole thing of having CPA, financial planner, dental intel after, I mean, I graduated in 2001 and I have to say having those people in place early has changed my life.
Thanks for sharing.
Changed my practice life, you know, telling my like planner, I want to retire here and like, tell me what I need to do. I'm more of a tell me what I need to do and I'll do it kind of guy. So you can't do that without having those people in place. So
I really appreciate you sharing that. And, you know, we're in the same generation of dentists. Also dentists, you're not supposed to know this stuff on your own, right? There was no course. I will hold dental school accountable, but there's some things that it's just not even part of the process. You need experts to come in. I mean, no dentist is going to say, you know what I'm going to do tomorrow on Monday? I'm going to take out 4 severely impacted wisdom teeth before my class 2, right? They would think that's crazy. We have oral surgeons for that. So I really appreciate you bringing that to light as a fellow practice owner, because hopefully that inspires some of the dentists watching to connect with them early. So thanks again.
I remember my practice wasn't like the second year. It was like, I could see that it wasn't doing well. So I got a CPA who was better and a planner, and they like, you need to produce this much. This is your problem. And then they gave me like a consultant who made it easy to do that. And it was life-changing. So that's good.
Thanks, Casey. Now tell us what's going on with molar media mount. I love the whole concept of the fun part, and also now you got a protective part. So share with us what people can, how they could use it to enhance the patient experience.
Yeah. Also, starting out, setting up your office, it's expensive. We had TVs in our office. They're in the corner. You couldn't see them when you're doing a DO on number 15, which no one enjoys doing. But now, so I had won in a raffle from a dental place and like an iPad mini. And I thought, what if I could put it right next to the screen or to the TV? I mean, to the light, sorry. They're always looking at the light. So I'm in my childhood dental office that I work in now. From 6 years old, I bought out my childhood dentist. Cool. So I have this like Pelton and Crane logo emblazoned in the back of my retinas from staring at the light for so long. So I just worked with my friend who's a prototyper, and we made this arm, and it hooks to your dental light, hangs an iPad, and it's right in front of the patient's eyes. If I move, it's magic with a kid. If I move the light back, the screen moves with the light. Their head just like moves back. I mean, I can like mind control them, and they can see it so well that, I mean, they're like giggling because I have some Bluetooth headphones we sell too. And they're giggling while I'm prepping a crown prep. And as a dentist, like, to know that my patients are like in a totally different place.
That's awesome.
And it makes me feel good that they're
I like how you sell the Bluetooth headphones too, so that you get the whole package.
You'll get a filling. It's pretty miserable.
Yeah.
What's that?
So they can get the whole package from you, the Bluetooth headphones and the molar media mount arm. So if people want to connect, this sounds like something I want to add to my mid-pandemic dental life. I want to make my patients happier. How can they reach out to you guys directly for this part of what you're doing with the arm? We have a text code here for you. Text molar to 55444.
Yeah, exactly.
And what if they? What's the website?
molarmediamount.com. Cool. We have all that on there. We have a buy two get one free deal. I will give you a heads up in November. We're going to do an all November Black Friday deal of buy two get two free. So
like it. Yeah, they get ready. Thanks for sharing that with the dentist people. Dentist people, Casey, they don't like to miss out on a deal, no matter what. So they won't show up on time for a CE course. Forget about that, but don't not miss out on a deal. What were you saying?
I went to a trade show just kind of like once, and I was like, wow, dentists are really cheap. That was my takeaway. Right. Being a dentist, I was like, yeah. So I'm always happy to give a deal. During the pandemic, someone emailed. So that was my idea. I'm not an idea person. I'm more of a doer. So I just took that and did it, and been selling them for 7 or 8 years and all over the world. It's kind of fun getting emails. So, but during the pandemic, someone emailed me that already owned one and said, hey, could you put a plastic shield on the end of it? So I was like, well, that's a great idea. So then we went for it, and then we made this, and it's just a clear shield that hangs between you and the patient. And I have to say, I don't, my hygienists use it. I use it. I still use the iPad on kids a lot when I really need it right now. So in the middle of the pandemic, I will switch back and forth between my face shield. But when you get used to the screen and everyone loves their face shield because I think they love the protection. But man, it's hot for me when I put it on after not wearing it because I don't wear it all the time. I use that. So it's like, this is ventilated and protected, and it's 12 by 12.
Tell me, I just want people to be aware. So this is something you could use instead of a face shield to protect you. Yeah. You told us on a previous episode, have you found a few things splattering into that? You're
my gosh. I did a filling on my friend, and then that day was my birthday, and my friends took me on like a night mountain bike ride. And during the mountain bike ride, the guy was like, man, there was a lot of crap on that screen. So like, even you got to think that your face shield's great, but your face shield is like up on your face. This stops it way lower, and it gets, I mean, I once I don't know. I grabbed a high speed during a wisdom tooth extraction it splattered blood all across it. And I was like, oh, that would have been my face or my.
I think it's, those are some unintended consequences of the pandemic that we should grab wins when we can get them. And, it's an opportunity to, increase some of your safety, decrease some of the grossness. I mean, dentists get used to grossness, but there's no harm in just decreasing some of it in our lives.
Yeah, I don't know about you. I don't think this is going away, the shield. I think everyone's realized that, like, oh, that was a good idea.
And also, I mean, because we had hygienists doing that years ago, that people would they wouldn't really make fun of the hygienist, but they were like, oh, look at this one who's so into the Shield. Now, you know, it's
Yeah.
become popular. So it's great for hygiene. There's Cavitron, there's things like that. So I love that. How can people get that Shield part? The same way by texting in?
We have a package. We have like a, yeah, you can just go on our website. I mean, that you can buy the molar media mount by itself, or you can buy them together. I think it's $60 more to get it together. And right now it's half, in November, it'll be half off basically. So
awesome.
It brings, I mean, that whole kit's $149, and you can hook an iPad and you can hook a tablet, or you can hook the screen, and you can switch back and forth between them.
I mean, I'm like, this is the stuff that really excites me. You know, we have a Nina Bond sharing with us, you know, she can collect all this insurance money, and the impact that she can have on a practice can be hundreds of thousands of dollars, right? But then I also love that for $149 in your operatory, you can make people's experience better, right? That's how life works, right?
And the patients thank you. They'll thank you for the video. They'll like kind of hang out in the chair afterwards. Like, that's how powerful it is. And then they'll thank you for the screen. I get thanked for the screen all the time, not because they know I made it, just because they know I'm protecting them. You know, it's life in a salad bar. That's what our life is right
yes, exactly. That's well, Casey, you stay on since you're our final guest. What I'm going to ask now for now is, this is Business Leadership Topping 5. Awesome lineup, great guests, so much to learn. I'd like everybody on it, if you're still here, to just share your video. If you'd like to come back on the screen, I'm just going to ask you one question in my crazy Dr. Nacho way of why I do all this stuff. And the reason I do all this stuff is so people get to bond and know each other. And my question is, it's an easy one. And just think of your one thing. What's one thing, or you could give two things. I know my dentist people. As soon as I say one thing, Casey, right? Why not two things, right? So one or two things that you learned from somebody else watching here that you said, I didn't even know that was a thing. You said, man, one of my clients would love this thing, or something I want to try myself. Can't be about you. It's got to be about one or two things about someone else to just bring to life what has an impact on you. I'll start with my friend, Alan Stern. So Alan, you're a dentist too. Me, you, and Casey and Scott are on here. Look, we're outnumbering everyone. That never happens. The dentist, Shane, Linda, you know, non-dentist. So Alan, what's one thing you learned during this that you didn't know before, or you think would be a good idea?
I really like Casey's thing. That, you know, we put these stupid TVs in places where people can't see them.
Right.
That also distract me from looking up at the TV. Now we got something that you could position right over the patient, who's the one we really want watching it. I think that's an amazing creative idea, Casey. Props to you, brother.
Well, thank you. Your assistants can't even watch it either.
Don't get me started on that.
Yeah, that's it. All right, Linda, what's something that you learned from any of the key resources and sponsors here today you just thought was cool, something interesting, or you never heard of before?
Actually, I loved Casey's product. I see so much benefit in that with all the clinics I go into. I'm going to start spreading the word. Thank you, Casey. That's awesome.
It's that small thing. I mean, it's always that, you know, it's like, it's what I call the funnel cake thing. When you're like or the old fashioned thing, you're at a party or a fair and you see someone come with the funnel cake, you're like, where is the funnel cake thing, right? And they go, oh, it's over there. Or you see someone with an old fashioned at a wedding, you're like, I didn't know they had those. It's just sharing something fun for someone else to make their life better. And that's what I'm trying to do here with the key resource sponsor. Thanks, Linda. Scott, how about you?
Yeah, I didn't know that Alan was open to a cup of coffee with pretty much anybody. I mean, I'm going to take him up on that.
That's awesome. I mean, yeah, just learn and connect with people and hear their story. It's about sharing stories. I always say the story's the star, and you get a chance to create a resource. I mean, things happen to me all the time. I mean, this morning I was asked to speak to 100 people from a group practice from my best friend in dental school who connected me with this person years ago. And it was just for that one connection. And he said, I'm a periodontist. There's periodontists who need someone first. And I just think that's part of the coolest things in life. So thanks, Scott. Shane, how about you? You're still muted, I think.
Now, can you hear me?
Yeah, you were good.
Okay, cool. No, I was just saying, you know, these are always interesting getting to see, you know, everybody's kind of expertise and what they do. But one of the things that, you know, I really kind of learned, I guess, today was through Alan Stern's talk, because Alan and I think I just introduced myself to you. I think last week, Dr. Pick had invited me, I think, to your Facebook group. We kind of commented back and forth. But, you know, as a marketing agency, of course, we're always talking to different dentists who are from the startup phase to maybe they're in their 50s, 60s, purchasing their first practice. And they're always, I feel like, looking for some sort of guidance and coaching from someone who's been there, done that. I'm the marketing guy. I'm not necessarily the dentist coach. And so having Alan as a resource is definitely something I took a note of here to see if any of my clients could ever, maybe use his services.
And I like that, Shane. And I think what you're sharing there, and Casey, I'll go to him last, but when you're a general dentist in someone's life, maybe Scott doesn't have this experience. I don't know if he practices as a general dentist. They think the general dentist has the answer to a lot of questions, that it's impressive, flattering, and kind of insane that they think you would have the answer to this question, right? When I go see Dr. Scott Drucker, is he going to use chromic or is he going to use nylon? I'm like, I think you should ask him when you get there. But when you build a relationship with someone, they trust you. And that happens a lot of times with marketing too, where they think in business, you must know about EBITDA, right, Shane? And you're like, that's not exactly my thing, right? So now when you have someone to send them to, I think that's so important that when you can just refer or share or connect. So Casey, we'll wrap up with you as to something you wanted to highlight. You're still muted there, but when you unmute yourself, you can share with us what's something that you learned or didn't know.
I think it was with Scott and just having a marketplace for ordering supplies from a bunch of different places. I think we get kind of pigeonholed into like using our one supplier, and like this opened up my eyes to like, oh, the pandemic, like we need to go out and like, but that's a nightmare in its own sense. So to have one place where we can go sounds like a great idea.
And I think that's really a good wrap up for why we do this, Casey, is because dentistry's had a uniquely cool road with this pandemic, and that, we can still exist in a lot of the ways that we need to exist, but we don't have some of the support and resources we're used to having, whether it's going to an in-person CE, whether it's going to an exhibit, whether it's just getting together with our colleagues. So hopefully we can utilize this. I think this will stick around too, to just learn. We're all in our homes. I mean, I live here underneath this table. I'll be here Monday again, but this is where we're on Zoom. So Casey, Linda, Alan, Shane, Scott, everyone who is here, really awesome. If you want a copy of this show, just email Business and Leadership Toppings 5 to flix@dentalnachos.com. Text that to 215-543-6454. Really appreciate you guys being friends, collaborators, sponsors. It means so much to us.
Thanks, Paul.
Thanks, guys.
Well, thank you.
What I'm going to do here, Nacho team, is just play one video to end. Thanks, guys. And then we'll see you guys at the next one. So I'm going to share my screen here, Ariel. And I wanted to tell you guys, I made this just the other day. If you're still here, maybe we need a new definition of what winning means. So I'm proud of this video because winning in life is not everything. It is the only thing. So this is my definition of what winning means.
One of my favorite things to do as Paul Dr. Nacho Goodman, a dentist, a husband, a dad, a Dr. Nacho, is to speak with and share with dentisting humans. And if there was one thing I could share with all dentisting humans, this would be it. Winning in dentistry and in life is not everything. It is the only thing. Winning in dentistry and in life is not everything. It is the only thing. But what is winning? Winning is not making the most money, having the fanciest practice. It's definitely not creating the most beautiful emergence profile the world has ever seen. While that's important, that's not winning. Winning is how you feel about yourself. Winning is how you make others feel. Winning is spreading more kindness in this world, especially in our dental world. Jewel put it best. In the end, only kindness matters. Let me update that for dentistry. In the end, only kindness matters, and the Krebs cycle. We can't forget about the Krebs cycle. It was very important to memorize it 18 times and forget it all 18 times. But what I want to share with you, as someone who's been a dentist for 18 years, which is a difficult job, and someone who's been a human being for 43 years, which is an even more difficult job, is that many awesome things will happen to you as a dentist and a human being. Many annoying things will happen to you. And sometimes, just as they have for me, many awful things have happened. It is the nacho plate of our lives. How we react, how we cope, how we respond is everything. That's winning. There's no contest. There's no score. The only score is your own happiness. Don't let the people around you dictate your happiness score. It's about you. And sometimes you think, I'll be happy later. Don't put your happiness on layaway. Many of you don't even know what layaway is. That was when you bought something and you paid a little bit for it and you would get it later. Don't let that happen to your happiness. There's always the chance to embrace happiness in small, medium, and large ways. Many of you don't have any money. And even worse than that, you're in hundreds of thousands of dollars in debt. You can still be happy because you can make a difference. You can make a difference in your own life and the lives of others. You can still have fun. I want to share with you a secret. Money does not make you happy. It's important to work towards financial stability. That's important as a dentist and a human being. But don't think when I'm out of debt, I'll be happy. When I buy a practice, I'll be happy, because along the way, you're going to miss out on some of the best things in life. You're going to miss out on the human experience. When people ask you for help, help them. When you need help, ask for help. Look for ways to build people up, not tear them down. Life is tough enough for all of us. Even people who look like they have it all together have challenging lives. Do not put your happiness on layaway. Make a difference in the lives of those around you in small, medium, and large ways. Ask someone to help you when you need it. Be that person who gives helps and asks for help. Make it normal. End the dental student and dentist Hunger Games and look to bond together, to use a dental term, look to bond together with your dentisting colleagues at every age and stage. Kindness can be cool. Making people feel good can be cool. There's no reason things have to be in a way where we feel insecure, unhappy, worried, concerned. There's plenty of things in life to be concerned about, and you want to be prepared, and you want to be aware, and you want to create a treatment plan for your life to make your life successful, whether that's buying a 3-op practice or a 30-op practice. Because I want to share with you, if you work hard enough, your dreams, they won't necessarily come true. Because my dream was to dunk a basketball in the NBA. But that dream has not come true. But my life, it's been pretty awesome. It's been pretty annoying. And sometimes things have happened that have made it pretty awful. And I've learned along the way that we need to embrace the moments of good stuff, of kindness, of time where we can say to the people in our lives, thanks for being there. I'm glad you were there for me. I want to be there for you. So if there's one thing you remember about me, about Dental Nachos, about dentisting, it's this. Winning is not everything. It is the only thing. Winning is not everything, it is the only thing. We just need a new definition of winning. And if I can help you in any way along your journey, do not hesitate to reach out to me. You can do so by emailing me at salsa@dentalnachos.com. You can visit dentalnachos.com, or you can text our hotline 215-543-6454. You might not need help today. You might need help tomorrow. You might want to share something. You might make me aware from. I may need help from you. That's how this crazy, wacky world works. The more we care, the more we share, the better dentisting world we can build together.